I get the link.
Okay, I'll call this meeting to order at 6 o'clock. The board met in closed session via Zoom and the following action was taken. Public employee appointment and employment, Amrik Singh for the position of Chief Human Resources Officer. Good evening and welcome to the Elk Grove Unified School District's virtual board meeting through the Zoom webinar platform. We thank you for joining us and ask for your patience in advance as we navigate this new platform for conducting school board meetings. Legislative bodies, including school districts, are now permitted to hold board meetings telephonically or by other electronic means because on March 17th, 2020, the governor issued Executive Order N2920, suspending certain provisions of the Ralph M. Brown Act. In addition, consistent with the March 19th, 2020 statewide shelter-in-place order issued by the governor, Executive Order number N3320, the Sacramento County Shelter-at-Home orders issued on March 19th, 2020 and April 7th, 2020, and the Center for Disease Control Social Distancing Guidelines, which discourage public gatherings. This board meeting is conducted via the Zoom webinar platform. Public comments were submitted to the board on items on the board's meeting agenda and also on items that do not relate to items on the agenda, but are within the board's jurisdiction. Tonight, as noted on the board agenda and district website, all electronic public comments that were submitted to the board through the Google platform will be provided to the board in writing relative to the appropriate agenda item. Please be advised that everyone participating via Zoom webinar is muted and all board member votes will be by roll call. Members of the board present tonight are myself, Board President Beth Albiani, Board Clerk Dr. Crystal Martinez-Alier, Board Member Nancy Cheris Espinoza, Board Member Carmine Fortuna, Board Member Tony Perez, and Board Member Sean Yang. In addition, today's Zoom webinar meeting is being video recorded and will be available on the district's YouTube channel. We always start with the Pledge of Allegiance, and my fellow board member, Nancy Cheris Espinoza, has gracefully agreed to lead our Pledge Allegiance.
Please stand. Hand over your heart. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Next, we have presentations and recognitions. We are going to start on an update with the Sacramento County Health Department. Ms. Pinkerton, are there any public comments related to this item?
Good evening, Madam Board President Albiani. There are no public comments related to this item.
Thank you. Mr. Hoffman.
It was my pleasure to introduce Dr. Kassiri to join us again from the Sacramento County Health Department. She's going to share with us some of what's been going on in the county with regards to health conditions and COVID specifically, and maybe give us some ideas of where she thinks we're likely to be in the coming weeks. So Dr. Kassiri. There she is.
Yeah.
Thank you so much for being here.
Thank you. Good evening, everyone. And thank you again for this invitation. So I'll start with an update on the numbers and then we'll go through. It's been very busy, a lot happening. And so hopefully we can get through all of it. So in terms of numbers, we total cases were over 75,000 since the beginning of this pandemic. And this week we hit over 1,000 deaths. So those are very sobering numbers to look at. We're averaging about 700 to 800 cases additional a day and about 10 to 15 new deaths per day. So again, those are all very sobering. And our case rate is now at 50 per 100,000. So a far cry from where we were at the end of October. So what has happened in the meantime, from the end of October, we've had the stay-at-home order that has was put in place due to the problems we were having with the ICU capacity. And so the greater Sacramento region has been in that stay-at-home order. And our ICU capacity hovered around 14 for quite a while, and then started dropping in December. And a couple of days ago, it was at, actually last night, it was at 9%. So we actually thought that we were going to be in the stay-at-home order for a few more weeks, but we got a surprise announcement, and that's why I'm saying this is such a whirlwind today, that according to the state projections, they are seeing that the ICU capacity for the greater Sacramento region is actually going to start going up and will be at 19%. I don't know exactly when, according to their projections, but they told us, okay, we are releasing you from the stay-at-home order. So we've been scrambling all afternoon, putting our order, updating our health officer order, because we know definitely a lot of the businesses will be anxious to be able to relieve at least and release some of the restrictions that they've been under. For example, that will mean that restaurants can now at least have outdoor eating. And I think places like personal services like hair salons and barber shops will actually be able to operate with modifications, of course, but again, be able to operate. So that's on that front with the numbers. And then with the schools, two things are going on. One is the state announced to us that they're in the process of updating the guidance that they have for school reopening. If you recall before, in order to start reopening, we had to be in the red tier for 2 weeks. But now what they're saying is that if our case rate goes to 28 per 100,000, that we can start accepting waivers similar to the waiver system that we had. If you recall, before the waiver system, it had to be the equivalent of 14 per 100,000, but now they've changed that to 28 per 100,000. Of course, we're still far from it because, as I mentioned, we're at 50, but still we do need to plan. And another major change that is taking place is that they are going to require that schools that reopen, and these initially it will be the schools, but the schools that reopen will be required to submit a plan that would need to be approved by both the county and the state. And that plan would have to include how you are going to provide testing according to the Cal OSHA guidelines. And I know that the Cal OSHA guidelines, their definition of an outbreak does make it really difficult for places like schools, because for them it's 3 or more. And so I think in a school setting that you can get to that very quickly. And even though the cases might not be related. So I know that one of the school districts, Folsom Cordova, has already gone through that. And in addition to that, the state is also going to require, or if you are going through the waiver process and if you're going to apply for the money that they're making available, they will ask that you develop a plan for testing. And they're saying it will either be every other week or every week. And this would be for both staff and students. So that's a huge, huge, huge undertaking. I know some of the smaller schools and smaller school districts might be able to do that. In Sacramento County, we do have some private schools that have been able to set up a system where they have weekly testing. But this was with the help of a couple of emergency ER docs that have been helping them in getting the staffing to be able to get that done. They've also been using our supply of the antigen kits called the Binax Now. But of course, if we are looking at larger school districts such as Elk Grove, the logistics there are very different. And so being able to think through that and how that would work. And of course, since they're releasing these guidelines, I think we all know that we will have to be able to see how we're able to meet them, because the unions are going to be looking for that. So they had told us that they might release the new guidance today, but there's a lot more that's been happening. So I guess they decided not to. So I don't have a date as to when that will be released. So with the testing, we have been talking with Dave Gordon and Nancy Hirota about how we can assist, because definitely the level of testing that we've been able to provide through STEM Express would not meet the need of being able to test both students and staff, and on a weekly or bi-weekly basis. The state has offered another program through a lab that they've set up in Valencia, and some of you may already know about it, but we are still looking at it to see how we can make that operational. And in with the kits they're providing, you can actually do what they call a self-collection, which would make it easier for staff. But I think there's still a lot of difficulty if you're expecting students to actually collect their own specimen. So I'm still trying to think through all that and trying to see, because I know there's this push to be able to start reopening schools in February. I don't see that happening in 2 weeks' time, but still, I think we still need to plan, because at some point we will have to be ready to open. And lastly, I wanted to talk about the vaccine. I'm sure you're all, looking at what's happening. We started getting vaccine at the end of December, just before the holidays. So it was a little bit of a slow start for us, because we had to wait for our providers to get be registered in the database before we could start actually redistributing vaccine to them. And that process, of course, was slowed down because everybody was trying to get registered at the same time. So there was a bottleneck. But we've been working through that, and now we have at least 45 providers that are in the database that we can allocate vaccine to. And our hospitals also, beyond them vaccinating their own staff, they have actually agreed to help us with vaccinating other groups, their patients, as well as other groups. Right now, we're still in phase 1A, but being able to get through that as quickly as possible. Staff in schools are in phase 1B. We've started having some discussions again with Dave and Nancy to see how that would work. Part of the challenges we have with the two vaccines that we have, the Pfizer and the Moderna, is that there are a lot of rules and restrictions about, maintaining the cold chain. You can't move it twice. If it goes out of the fridge, you have to use it in 6 hours, and a lot of things. So it makes it difficult, and that's what we're trying to explain to them, that it makes it difficult to be more mobile and have some of these smaller clinics where we could get some vaccine and just come to, say, a site at a school and do all the vaccinations at that point. Thus far, the strategy that we've been working on is getting some of our larger partners able to set up large or mass vaccination clinics, So for example, UC Davis, Cal North State, and we are also looking at being able to set something up with Sac State. The pharmacies are able to set up smaller ones. So we've been able to work with Safeway, and that does make it more convenient for a lot of people because the Safeways are distributed all over the county. And so it makes it much easier for people to make the appointment, go in, get their vaccination. And the reason is that pharmacies already have all of the refrigeration that is required, and they're accustomed to working with this kind of vaccine and medication that requires all kinds of restrictions and checks. So it was a very easy partnership. It will be a bit more challenging for some of the health clinics that might not have the refrigeration capacity. So I think as we go further down, and if we have other vaccines that come on board that are easier to handle, then that might be a good option. But right now, we have to work with the larger ones that do have the refrigeration capacity. We've also opened a site at Cal Expo, and we're planning to expand that as well. So up until today, our goal was to get through phase 1A, which is healthcare providers and social workers in January, and then start phase 1B in February. But it seems like now the federal government has issued new guidance saying that we should all be vaccinating anybody who's 65 and above, especially those with underlying conditions. So now we're scrambling again saying, okay, we're still working with these professional groups, but now if we're going to 65 and up, that means that we have to figure out how to do outreach to a lot of different places, especially some of the harder to reach communities, low income, or some of the communities that still have a lot of reservations about the vaccine or about government in general. So we're starting to set up a stakeholder group, but now I think we'll have to speed things up, because now if we're going to have to do outreach real quickly to those groups, I guess we need to be able to get messages in place. So a lot happening, a lot that's thrown at us, a lot that's changing. But I guess I'll stop there and see if you have questions.
Very much. I am sure we have questions. We'll start with Dr. Martinez-Alier.
Hi, thank you for the update. I always look forward to hearing the information. I had a couple questions. One, I know you had mentioned previously when an outbreak occurs, specifically you mentioned a school district where that may have happened, where there's 3 or more students. During that time, is the district required as well to do the contact tracing?
Yes, the contact tracing is done mainly by the school. We do have a school team that helps, but what we've found is because the schools have access to all of the records, it does make it easier for the school to do the contact tracing with support from the county.
I had a second question. I know you had mentioned regarding the testing for the children and that being something that's being worked out. When do you foresee that possibly having a thorough entity that may be able to test for the children? Because I know right now it's only per the adults, is my understanding. So do you foresee that in the next few weeks, or?
Yeah, we're still working out the details, because recently the state made the Valencia lab available as an option for schools. And so it does make it more feasible, because I think what makes it really difficult to set up these testing, apart from, of course, the logistics, is also the cost. And so if the state is able to at least provide the test and you don't need to worry about that, then the other issues you need to think about is how do you have people who, especially for children, if you're going to include children in the testing, they need to be supervised in, even if they're doing their own self-collection. So having enough people to do that can be a challenge, especially for the larger schools and larger school districts. And
then
we're the details. I don't really have a firm timeline right now. I know that there's this urgency because, you know, of course, students want to get back into school. Parents want their kids back in school. And now the state is also saying we want the schools to open in February, but then we also want to do it safely. So one of the things that we have to look at is our case rate at 50 per 100,000. Yeah, we're way above the 28, and even 28 to me sounds high, but that's the new threshold that the state has put. That at least that's when we can start considering the reopening for those that have not opened already.
And then my last question is regarding the phase rollout of the vaccine. I know in the phase 1B, that's the where the educators will be able to receive their vaccination. So I was just wondering, is there the time frame or the plan where the communication, because I know you mentioned outreach is being done currently regarding the other age groups of 65 or older. So I was just wondering, as far as outreach, when that does roll out, when do you foresee that for the next phase in the next group of individuals?
It seems like everything is happening really quickly. So as I mentioned, we are having discussions with SCOE right now, and hopefully we'll have a plan that we can roll out quickly enough to give the educators some idea of how that is going to roll out. And as I mentioned, I think what will work best is to have several options. One being able to go to their healthcare provider, especially for those that have healthcare providers that belong to the larger hospital systems, Sutter, Davis, Kaiser, and Mercy, because we know that they have the vaccine and they would be able to do the vaccination. The other would be some of the other options that we've set up, such as I mentioned, the Safeway pharmacies. We're also hoping that we can get others on board, such as Walgreens maybe, and also being able to have appointments at the mass vaccination, such as the Cal Expo.
Thank you for your time. I always look forward to you giving us updates. So thank you again.
Thank you. Ms. Charis Espinoza, who will be followed by Mr. Fortuna.
Thank you so much for being with us again, Dr. Kassiri. I have a few questions. I'll just go down my notes here. So the change in the state guidance, their recent announcement about the stay-at-home order being lifted is based on a projection of where we will be in the next 4 weeks, right? But even though our case rate is still high now, meaning the threat is still high, is that order effective immediately?
Yes, they made it immediate. That's why we're scrambling, because usually we have a little bit of lead time to get our orders in place so that once they make the announcement, we're ready to go. But we got to know at the same time that everybody else did. So now and of course, knowing that the businesses are anxious to get started, we should have it ready by morning, and it will be effective immediately.
It's like it makes more sense for the restrictions to be lifted concurrent with the decrease in risk, but okay. Let's see, I had a question here that you answered about, can you just handle this testing for us? But you answered that, and that was a vain hope. Getting to vaccine distribution protocols, within a phase 1B, there are many groups, including teachers and school staff, who obviously we care about a lot. Within phase 1B, once you are able to release vaccines in that group, is it everyone within phase 1B, or is there still an order within that tier, if you will?
Preferably, we would have wanted to do it in order because it makes it easier. But what we found with phase 1A is that's how we started off. But it turned out that it was so restrictive that, it was causing some difficulty with movement of the vaccine. So I don't know whether they're actually going to just do away with that and just say anybody in phase 1B, but I think internally we would still want to be able to have some order in terms of how to do it. My thought is if we can get enough providers on board and enough vaccine, we can handle starting with multiple groups at the same time. What makes it difficult, and also knowing how much you're getting, what makes it difficult is if you don't know whether you're getting 10,000 or 5,000. So you don't want to register people and then have to call them all up and say, oops, we didn't get enough right away. There are a lot of people who are very anxious to get this vaccine, and any uncertainty makes everybody very angry. So we're really trying to manage expectations, but it is difficult when there's a lot that's not in our control. But what I can say is if they give us the vaccine and they make it easier for us to redistribute it to our partners, I think the best would be for us to be able to, for example, what we did with phase 1A is we'd say, okay, all of the specialists and dentists, you're going to go to UC Davis. All the social workers, you're all going to go to Safeway, and so on and so forth. And then of course, if, for example, Safeway calls us and say, hey, we're not full, can you send us some more? Then we're able to manage that. It will become more of a challenge also though, as we go into the general public, especially, for example, if they're telling us that you need to start vaccinating everyone 65 and over, because we don't have a good list for that. So it might be a matter of having to put out a general press release and also outreach. And I think being able to ask them, hey, first check with the healthcare provider. If you're able to get it there, then that would be the best. If not, then these are additional options, and have those options open. But again, trying to manage expectations so that you don't have someone trying and every place that they're checking, they're all full for the next 4 weeks. That again causes a lot of anxiety, and we want to prevent that. We've been able to do it so far because we have a good handle on the groups, but it's going to be more challenging as we go down the list.
Thank you, Dr. Kassiri. What do you do in a circumstance where the state vaccine distribution priorities are different than the federal ones? I heard you talk about what just came out of the federal government yesterday. And I know prior to that, the CDC had done some work and laid out really detailed recommendations. That's where we got the 1A and 1B from. Then the state of California, also through its own advisory work, made some tweaks, if you will, refinement. So who do you listen to when the state says one thing and the federal government says another?
Well, ultimately, I am responsible to the state.
Mm-hmm.
My hope is that the state and the federal government won't create too much of a schism. As you've mentioned, there are some differences. For example, the state had actually already made a decision to move up the category for those 65 and up. And part of that is because when you look at the numbers, the death rate in that group and is really much higher than for any other group. So if you can get to those first, it's going to take care of the hospitalization, which we've been so worried about, the ICU capacity, the outbreaks in the long-term care facilities. And then, being able to reach out to the others as well would be important. But again, hopefully they talk to each other so that if there are any differences, they're able to figure them out. But ultimately, we follow what the state tells us to do.
Thank you. And I won't get off on a tangent, but we in the education land are familiar with that predicament. Okay, so I have heard of other school districts that are maybe piloting testing of their employees, and they have a lot of people opting out. So what can we do if we can't get close to a majority of our employees to and they have to volunteer, right? They have to voluntarily agree to be tested. And if say it's 30%, 40%, whatever the number could ultimately be, how valuable would our testing program be? I mean, should we be relying on something like that to determine whether or not it's safe to operate in person?
I agree. It does make it difficult. It's dependent on everyone seeing the value of the testing and voluntarily agreeing to it. There's no way of forcing anyone to do it. All you can do is if somebody does have symptoms, you can ask them that they have to stay, off work until they are cleared by a healthcare provider, but you can't force them to get tested, even if they have symptoms. So yeah, that does create a challenge to some degree. And my thought also is that, especially for those that may have some reluctance to testing, if they see that, the vaccines are coming up, the first question they're going to ask you is, why don't we just wait, get everybody vaccinated, and then that will take care of things. But then you also still have those who will say, wait a minute, okay, we are vaccinating the adults, but we're not at the point of vaccinating the children. So there's still that level of vulnerability. So I think we're going to probably continue to have to deal with this. And that's why we tell people that to a certain extent, we're still going to have these modifications, measures of 6 feet, face masks, just because of some of those uncertainties. And I think we can all just do the best that we can, have as good a plan as we can, and then see how we can execute that and deal with each of the problems as they come up.
Okay, just one or two more, Madam Chair. So this proposal that the governor made a week or two ago, in-person instructional grants, right? $2 million that should help schools reopen safely. The draft language that they released has something in there that says that schools can submit their application to the county, I think, but the county public health officer has a few days to object, right? If the county health officer says, I actually don't think it's safe enough for you to reopen. I know it's early days and this is a draft proposal. How do you envision making that decision? I mean, what would the criteria be? And the reason I'm asking is because it seemed to me that the safety tiers that we have in place say that you should be at like 7 cases per 100,000 to open. And then all of a sudden the next day comes this program that says, well, maybe 28 is fine. And there's a big gulf between that. So I'm just wondering, can you bridge that for me or just explain how you determine that it's safe at 28 or anywhere between 7 and 28?
Yeah, I understand exactly how you feel, because those are the exact questions that we were asking ourselves, because it's like, wait, you're telling us it was based on, a lot of discussion, a lot of research. How can we just change it so quickly? So it does, I think it does create a certain level of uncertainty, again, nervousness about being able to move forward. I think what gives me some comfort is knowing that if we can get to the point of the vaccination, because that will provide a lot more protection, and then being able to continue with the testing and all the other, the mask and face covering, I think that will help. But if we were dependent only on testing and we still had these high case rates, I think it would make me nervous. I also believe that as we start doing more of the vaccination, that we will see the case rate starting to drop. So I'm hoping that within this next month of February that some of those dynamics are going to change and that it will make it more comfortable for us to make those decisions, especially if the school has a good protocol in place for, you know, all the different measures for the testing, the protocols for the, you know, 6 feet separation, face covering, as well as also being able to have access to the vaccination. So it's going to take a comprehensive plan. It's not just, can't be based on just one thing.
Okay. Thank you so much for your indulgence, Dr. Kassiri. And you've really impressed upon me the complexity of trying to operate both a testing program on a mass public scale and a vaccination program at the same time. And at present, schools are being asked to do the first, right, testing. And I think the time will come that we will also be asked to operate vaccination programs. As daunting as that is, in an education world, we really try not to take on jobs that are outside of our core mission, especially since we're never given the resources to do them. You know, but it's also not the time to shy away from things that are really hard and really complicated. So I'm grateful for your guidance as we try to navigate all of this. For me, Madam Chair.
Thank you.
Thank you. Mr. Fortuna, who will be followed by Mr. Perez.
Good evening, Dr. Kassiri. Nice to have you back. I just have some quick questions. First of all, you mentioned that there's been, you know, 1,000 deaths. Who are they? Not by name, certainly. Categories where the prevalence was. Who are the 1,000?
So a couple of things. When you look by numbers, about 80% of them are in individuals over the age of 65. So that age group has been hit really hard. And then also when you look at the deaths, about 50% of them are in people who are in congregate settings. So if you're looking for the highest risk, it's the elderly in congregate settings. They get the most severe disease. They're the ones that are at highest risk of death. And in fact, we were this morning when I was presenting to the Board of Supervisors, I was talking about the fatality rate, which is by definition, it's the number of deaths over the number of cases for a certain group. And when you look at that, the overall fatality rate for COVID-19 is about 1.3%. We had zero in children, fortunately, but you see that by age, that number goes up, and it goes up to 8%, but for those over the age of 80. And then when you look at those in congregate settings, long-term care facilities, it actually goes up to 13%. So that just gives you an idea of where our highest risk is.
Thank you. And that kind of bears out all the studies that have been published to this point, that the death rate in children and the illness rate, they're low.
That's correct.
Okay. A lot, and then my next question is, somebody might say, why is he asking that? It's kind of stupid, but I ask it for a purpose. All my questions are always for purpose. A lot's being placed on testing with respect to going back to school. However, while testing certainly might identify some individuals who might not otherwise be identified as having the virus, it's only good for the day it's taken, correct?
That's correct, yes.
Yeah, it's just a snapshot of a very short period of time. And I guess, for me, that presents problems with respect to making big decisions on what you're going to do with respect to bringing kids back to school. When it is just a snapshot. And given that, what would be your guidance, if you can share it, or your belief with respect to the immediate opening of schools where the incidence has been very low?
For schools that have had, well, if a school has been closed, then the incidence will be very low because there's nobody at the school. But I think in general, the best is to not, as I said, put all of our emphasis in just one strategy. We need to have all of the different strategies in place in order to be able to be successful. And I think what makes it more promising this time around is that in addition to being able to have the testing, in addition to being able to have protocols for social distancing and face covering, we actually have the vaccine on hand, and our goal is to start vaccinating phase 1B starting in February. So if you asked me what's the best case scenario for us to be able to actually start having children back in school on a large scale, I would say that making sure that we're able to start the vaccination for the staff as quickly as possible. And then in addition to that, having these other measures just as a way of a precautionary to make sure that we make it as safe as possible. And again, as I mentioned, I believe that as we start having more and more people vaccinated, that it's going to impact our case rate, and that will start going down. We're just at the beginning of this whole endeavor, and we have 1.5 million to go through. So it's a huge undertaking, but I think it's doable.
Yes, but specifically, or maybe for clarification, the question I was asking when I said when the incidence has been low, what I'm referring to is the zip codes within which all the children live. If they've been low to nothing, should those kids be penalized? Is it wise for a school district to follow an all or nothing policy?
Well, right now, actually, that is not even an option because the disease is so widespread that there's no zip code that has low positivity or very low case rate. So until we can start getting these numbers down, and actually my thought is that when we get to like the case rate that they're talking about of 28 per 100,000, we're going to start seeing those differences so that we can make those distinctions as you've talked about, and maybe the school district can start thinking, hey, okay, this area has very low case rate. Can we just go ahead and start working on getting the kids back in school? But right now it's too widespread.
Okay, thank you. Am I correct in my understanding that Santa Clara County tests children?
I don't remember. I don't know. I know that in Sacramento, some of the private schools do have a program where they're testing the children as well as the the staff, but I don't know what Santa Clara is doing.
Okay, yeah, I think I'm correct on that. And I know my own grandchildren get tested and they're in Santa Clara County. Just by way of notification, just information, I go to UC Davis for my healthcare needs. And I've been notified by UC Davis that they're certainly aware of all the various categories and needs. And they will be notifying patients as their supply dictates with respect to the various categories. Irrespective of my young age, I'm in the high-risk category. And I received a notification a while back that they're certainly aware of me. And as their supply dictates, I'll just be notified and they'll set an appointment. So I know they're following through with their patients. Here's a tough one, and I don't know your comfort level certainly in answering it. You know, there's an old expression about it's time for the rubber to hit the road.
Mm-hmm.
At a point in time, we will make the decision, we're going back to school. And we recognize that there are staff who will be reluctant to be vaccinated or just plain will not be vaccinated and they want to stay at home. Is the health department going to come out with any kind of guidelines with respect to what employers should do if they are making a work requirement and its employees decide they don't want to follow the directive?
That's a tough one. Probably the only employer that I'm thinking might go that route would be the hospitals and healthcare industry. I really do not see that happening for other employers, but definitely, you know, a business could make that decision and say, if you don't get vaccinated, don't come back. But it's not going to come from us. It's not going to come from the state.
Okay, thank you very much.
Thank you. Mr. Perez, who will be followed by Mr. Yang. You're on mute, Mr. Perez.
So many.
Oh, there you go.
So many questions. Oh, yeah, yeah. Okay, I'm gonna start. You mentioned there's all strategies need to be in place, right?
I don't know what exact words I used.
Okay, well, I wrote that down. Well, do you think, did we ever have all our strategies in place? I do not. You know, I think we failed our community with testing, outreach, education, prevention, a variety of things. You know, and that's not on you, it's on our public health and our leadership, our legislators, all the way to governor. Well, our governor is pretty good. He's done a lot, but yet people became complacent and thought that, oh, that's okay. Boom. October, we had this big merge, correct? So is that over? October, Halloween? That's over, right?
Well, so the surge started in the beginning of November, and we had a surge within a surge. We're still waiting to see, hopefully, that the impact from the holidays,
Christmas and New Year's.
Christmas and New Year's. We're still in that phase where it could have an impact, but so far we're still at a plateau. So our hope is that after this, we'll just start going down. And referring back to what you said about strategies, I think acknowledging that all of us are dealing with a situation that's way beyond the resources that any of us had, and doing the best that we can. And I think as far as I do acknowledge, yeah, that for example, testing for the schools, it would have been better to be able to have more of that available, but that was the limit of the resources that we had at the time. And we were able to actually open some of the schools because the rates were low enough. But now that the rates have gone higher, being able to test more so that you can have, isolate and quarantine people quickly does help. So it's what I can say is it's imperfect, yes. But definitely we do the best that we can in terms of being able to use all of the strategies that we have available to us.
Okay, so I mentioned earlier that, and you mentioned that November peak was the result of the Halloween and mixing of people. Now, that was what, as I read, it takes 2 to 3 weeks after that particular holiday. Like, for instance, have we met 2 or 3 weeks after Christmas and New Year's? We haven't seen that reaction yet, have we?
Not a lot. It's like I said, we are at a plateau.
Right.
And as you've correctly mentioned, yes, it takes anywhere from 1 to 3 weeks, actually. So I think next week we still have to wait and see what happens.
Right, that's what I read, that it could happen within tomorrow, next day, or within a week. We could see another surge as a result of Christmas and New Year's, right?
That's correct, yes.
And also, not only that, the flu, right? It's a possibility mixed in with that. And so what I'm saying is that
we've been fortunate, actually, and this is true not only here in the US, but it's been the case even in places like Asia, where it's been a very mild flu season. And it's thought that two things: one, that the measures that we're taking to prevent COVID-19 are actually very effective for the flu as well. So that's to make it milder. And also, for example, in Sacramento, a lot more people took advantage of getting vaccinated, and that was
I'm one of those. Yeah, me too. I took precautions, prevention, and all that. And I think the reason behind that is because people have been staying at home, not mixing, and staying in their bubbles, the home household bubbles out there. So I think personally that's one big reason why people have not broken out with the flu. So that's my prediction or analysis. As a result of that, any day, within a week, we could see Christmas and New Year's coming, and again, you'd probably be shut down again. That's a big possibility, correct?
Well, definitely, it's something that we are thinking about, and
right, we're worried about it.
And worried.
Yeah,
but
worried.
As I mentioned, our efforts right now are being able to get out as much vaccine as possible,
Right.
because that will help in protecting and having us not have to revert back. Because I know everyone's exhausted, everyone's tired of the shutdown, everyone's tired of all of the restrictions. So I don't think that it's something that people want to go back to.
Right.
And so, we're going to do whatever we have in our power to be able to prevent that.
Yeah, me too. I'm tired. Someday I might get a haircut. So
Well,
anyway,
you can make an appointment tomorrow.
I thought about that. So anyway, let me get back over here. As a result of this, I'm very astute using geographics information systems, mapping software to do outreach and do analysis of community health needs and outcomes and all that. So just recently, the Sacramento Bee came out with a good article of the highest density of virus. And it just so happened 95828, which is area 1 that I represent, is within the highest incidence of virus. And because the fact it is a high poverty, multifamily housing situation and a variety of other things, and they're the working class that has to be at work face to face. They're the populace does not have the privilege to be on the internet and work at home, blah, blah, blah. So how are districts, or how is the county health consultants taking that into the equation of opening schools? They don't go, that's a big problem I always had with the health outcomes. You know, yes, we grade the state, we grade the counties, but sub-county areas of like health professional shortage areas, medically underserved areas, medically underserved population designations, we do not give enough funding and outreach and educational resources and health resources to those geographical areas. So as a result of that, we have a high incidence of a variety of health issues and educational issues because of poverty. So what's your advice in the Valley High School and Florence High School District? You have for us as board members and Mr. Hoffman, do you take that into consideration when you open up schools, or do you say that we need to test, we need testing of 75% of that population in that geographical areas in order to determine it is safe or herd mentality in those areas? See, I don't hear those progressive preventive things at the county level or at the state level. And those are issues and guidelines that need to be in place in order to reopen our schools. Because the fact that we saw a variety of local school districts, what's the word? Back and forth, opening, closing. And as a result of that, people have gotten sick and community spread and people have died. Correct?
I'm not aware of that, actually.
Well, I know that in some school districts, people, staff, in educational settings have died of COVID virus, And another thing in place that we don't have is data sets like, they have on other school districts. So why don't we have a matrix or a mapping software? But you have data sets and within a zip code areas, and you don't have data sets that include district boundaries to determine how many individuals are ill, with the virus, how many cases, how many people have died in those geographic areas and within the boundaries of counties, zip codes, and this school districts. That's what, I know they want to do that, but yet, I haven't seen our county providing that services. I mentioned that to you, but yet I have not received any of that database back to me regarding that issue, or a map telling me how many cases do I have in my area 1, how many cases do we have in area 2. See, Mr. Procino is concerned about that. I'm concerned about that because if there is no 0 cases and that community hub bubble, household bubble is good and there is no, as a result of no testing, then yes, I could vote, yes, let's open that geographical test, the school site and areas. I'm willing to do that, but I cannot make a decision on opening schools when I know for a fact that, less than 10% of the community has been tested,
Mr. Perez,
Yeah.
Mr. Perez, I do want to just say real quick to give Dr. Kassiri credit. The last time that she was here, we asked about being able to get more updated information with regards to the zip codes, because the way the data on the website before was just totals. But now they actually do have another data set on the county website. I believe it's the last 30 days instead of just a running total. So they did respond actually to the question that you asked last time. Now they're not doing it by, by trustee area for us and for the other 13 districts in the state. They don't have the capacity to do that, but they did make the adjustment by zip code. And I believe it's 30 days so they have a running number that's more up to date than just the running total that they had previously. So I want to give them credit that they did make an adjustment based on our request last time.
Right. So, right. Well, I wasn't aware of that. Well, why didn't I receive the information? The right foot has to know what's happening with the left foot. That's a problem. So anyway, I know for a fact that school districts are putting this information in map detail on their webpage. I've seen this of other school districts within California. They are putting data sets of how many cases within their school boundaries, within their school sites. And that's what I want. And I think that the community wants that. They feel more at ease if they see that. And then we could propose, yes, let's open that school up over there. There's no zero cases. There's no community spread. Let's do that.
I think you're mixing up two things though, because the data that the county produces is for the entire community. But what you're talking about with cases on school dashboards is what we talked about, where the school is actually doing their own contact tracing and then they keep track. And I know, for example, Folsom Cordova, because they're open, they actually created a dashboard and they're providing that information. I think part of the difficulty also is because we use different databases. If we try to do it at the same time that the school districts did also, which we tried at some point, our numbers don't match. And then everyone's asking, why don't they match? What's this? And you're spending so much of your time spinning your wheels, trying to figure out where the differences are, when actually, in the big picture, what really matters is to be able to know, okay, what's the community spread like? And also the specific school, what are the numbers like? And you can do that yourself. So, and that's the conclusion we came to, is that the school districts, it's much better and easier if they kept track of their numbers. Of course, they provide the information to us, but then they have ownership for their numbers. They're able to track them, and we work very closely that way.
Exactly. I'm very familiar with that issue that you talked about. But most people I see are doing the Johns Hopkins database. So yes, and I am support of the school districts doing themselves, because they know themselves. They're at the front line. They know exactly when a staff person is sick, and when they do the tracing, they know who he's been in contact, et cetera, et cetera. And there's no opposition through the unions or whatever. So, that's what I'd like to see in our district, but it's hard to get 4 votes in this district. Okay, another thing that I like, and I've seen that the benefits of school health clinics, how they're participating. Some school districts who have school health clinics are very at the forefront of dealing with the mental health situation that we presently have, and vaccinations and health educational issues of our students. So, and I've seen some studies regarding those children are more academically ahead of the curve in those school districts. Another thing I'd like to talk about is when you talk about testing or vaccines and this one and our staff, now, is it teachers only or the whole school staff?
It would be staff because it's not, teachers are not the only ones that have
Right.
interface with,
I want to make
with
that perfectly clear.
the students.
Because
Yeah.
also all the way to the administration office, correct?
Well, initially, it will, of course, will be focusing on those that have direct interface as opposed to the ones that are, you know, working in administration, working in an office and are not interfacing with students, but definitely.
Yes, but, you know, those individuals that we have, those principals, those some teacher leads, they go to our district office, and that's what I've been trying to tell some of these assemblymen and senators out there, is that they need to make sure the whole district's well, not just the teachers. And I want to make an emphasis that it's the whole staff. You know, how can people come to our district office when and not knowing that they have not tested negative or positive? And us, even us as board members, you know, we should even be tested. That's the way I feel about it. Is that the fact that, you know, right now, you know, when we go to the district office, you know, we do have to, you know, deal with the guidelines, but yet, you know, we need to open up our district office also for our parents and our community members for a variety of services and interactions with workshops, things like that. So, and also for our board meetings, you know, I like this, but I don't like it. So, you know, there's some pros and cons regarding this virtual meeting situation because of the fact
Mr.
that.
Perez, those are us issues. I'd like you, if you have a question that are specific for Dr. Kassiri,
Okay,
that would be all, because those are things we can work out. And because she's got a lot of work to do tonight in order to get her communication out to all the businesses that want to open the next couple of days.
well, so our business, well, we are a big business. We,
Right,
know,
sir.
we're the biggest business provider in Elk Grove City. You know that, and I know that. So I got to make sure that you are safe and healthy to make sure that everybody else's health and safety. That's what I'm concerned about. That's why I bring this issue up, because
I
nobody
appreciate
talks
that,
about
sir.
those issues. Okay. So the other question I have here. Do you have data sets by our district?
I'm sorry, what was your question?
I was wondering if you have data sets by our districts, because you mentioned that you met with Dr. Gordon at the district office. Well, you know, did you go and say, hey, such and such district has X amount of positive and negative testing, or what's the community spread in that area? So did you, when you met with Dr. Gordon at district office, did you provide him with any data sets or any input?
Whereas they don't have the data broken down.
Geographically, what
by
areas
district.
are high need of outreach or whatever? Or did he ask you for anything like that?
No, Mr.
No.
President, they don't have the data broken down by school district. That's not
Yes,
right. The data is not broken down that way.
but did you have that conversation then? And was that?
Okay, just to clarify, the conversations that I'm having with Dave Gordon is to develop strategies for all of the school districts.
Right.
As far as district-specific data, I know that the SCOE probably has it in terms of, for example, how many staff are there and that kind of information. And as I mentioned, as far as cases, each school district is keeping track of their own, the ones that occur within the school. We do at the county level do it by zip code. And we feel that that gives you enough information to be able to make decisions. Again, our discussions with Dave Gordon are in general strategies, knowing that, of course, each of the district might be a little different, might have different needs, and those are things that are discussed separately.
So the question, like Mr. Forcina says, there's a purpose. So is science and data driving the issues or the decisions? That's what I'm wondering about. Or is it, you know, economic impact of the community that's an issue? You know, so is science and data driving the decisions of Dr. Gordon and staff to open or?
No, that's a question I think you need to ask to him.
Well,
you know.
Mr. Perez, we're working with Dr. Kasiri and her team because they are the medical experts. We're using that. They're the ones providing us with this whole time. When we went back and started to work on our plans originally, there was guidance that came from the state and guidance that came from the county health departments. That's what we're using in making our decisions and our plans. And then we share our plans back with them to make sure that they meet those criteria. So we're working with Dr. Kasiri. I mean, she's probably tired of seeing us, tired of talking to us. Well, we all like each other and all, but we see each other and talk to each other a lot. We're working together closely.
well, let me tell you right now before I forget, I'm glad you do this, doctor, because, you know, not all school districts are doing this, you know. We're very fortunate to have you and, you know, face to face and talking to you about these issues, but I don't think all these issues are being brought up or because of this or that. Okay, the biggest question I have here is, have you seen the Governor Newsom's proposed plan to open up schools? And
I know of it. I know some detail. I don't have a copy with me.
okay, well, anyway, he likes us to open up within next month and have testing with students and staff.
I'm aware of that, yes.
Okay. And so do we have the capacity to do that? Because, you know, if we decide to do that, and I do not know as of today if we're going to do that or not, because we as a board have not made that decision. Do we want to open?
Well, and that's what I said at the beginning. The discussions that I'm having with Dave Gordon is figuring out how we can make this operational. But of course, it's still in the planning phase, so I don't have a lot of detail to give you.
It's very fast track, and I'm not sure if.
I'm aware of that, yes, but and they have not released the guidance. They've discussed it with us, but some things might also change along the way. As I've mentioned, we are working on being able to see how we can help with being able to set up the testing, which is one of the big issues. As far as protocols, I think we've been working on that all along. And especially when we had some schools that went through the waiver process, we do have a process in place already for being able to accept and review protocols from school districts and from schools. So I think that the biggest part that I see is, one, looking at how we can operationalize the testing, and the other is also being able to make the vaccine available. I'm very aware of the fast track. Our staff have been working long hours trying to figure all of these details out. So as soon as we have the details worked out, we will provide the information.
Dr. Kasiri, Mr. President, I just want to make sure for clarification for you, just to be a reality is the capacity to do all the testing and run all the tests through labs and get those results back in a useful time. If that was to happen across the entire state, that the capacity to do that is a big concern, correct?
Correct.
So hold on here. Hold on here. I don't think so. You know, we have UC.
This is the doctor of the health department telling you the capacity of the state to process the test for kids across the state. That's a challenge.
No, I'm okay. Right now, I'm talking about, can Sacramento County do that? Does Sacramento County has the capacity to do that
No, we do not.
as of today? And is it because of money? Is it because of funding or the labs issue?
It takes a lot of, to be able to increase capacity. And right now, actually, our public health lab has increased its capacity. But also of note is that we're doing all the testing for the jails and the homeless plus the outbreaks as well. And so that does take up all of our capacity. That's why we had a contract with STEM Express to be able to provide the testing for the community test sites as well as for the schools. But that was taking into account being able to do it like once every other month. But with the increase in testing frequency, we do not internally have that capacity. Plus also you have to look at the costs. I think it costs about $150 per test. So if you're doing that every week for every staff and student, that can add up very quickly. So that's why the state has provided the option of being able to use the large lab that they have. But again, we have to work out the logistics. How do we collect the specimens? How do we get them to the lab because it's in Valencia? So those are the things that we're working out.
Well, I was enlightened tonight that per student, we may get, if we get our plan within time, within next month, that we possibly get, what, $400 to $500 per student. And then also, and supplemental and concentration monies or base monies to over that amount.
No, that's the amount, and that would cover 3 tests for an individual kid, but that's not saying we're hiring any of the staff that you would need to do the testing every day to send it off. So there's the funding piece. We need to do some deeper dive into it. We'll present that to you on the 20th. We've already, we'll make sure you have that information, but the cost of the test and the manpower, person power we would need in place to physically do the testing, collect the samples, get them to the lab. If the lab had the capacity to turn them around in time fast enough for us to be able to act. If you remember way back in the day, it was taking 6, 7, 8, 9, 12 days to get the tests returned to us. And the quarantine period was over by the time we got some of those results back. So there's a lot of work to do to be able to ramp up capacity to test kids across the state and across the county of Sacramento.
Well, again, I think we're reacting too slow in this process. And as a result,
I understand your perspective.
Yes, and I know for a fact that he's willing to put how much? 2.8 billion? Billion?
400 and some odd dollars per kid. That's 3 tests, Mr. Perez.
Yeah,
That's 3 weeks worth of testing, and that's not counting
Okay,
the people.
Gentlemen, we will discuss the money on the 20th. Mr. Perez, do you have any other questions for the doctor? Because she does have a lot of more things to do and she has given us a large amount of time. We have 2 more members that would like to speak to her. So did you have any other questions for her tonight?
Yes.
Okay.
There's more a comment. We have a lot of hard work to do, and I'm very glad that you're there doing this, and you have a very good perspective of what's happening in our communities of color, and the needs of our staff. And a big issue I have, and let's know that a lot of people need to understand this is the hub of government, and we have to keep this geographical area healthy. And if you want to stop the spread, we have to be doing a lot more testing and analysis of our communities, and then open up schools. Safe for everyone. Thank you very much again.
Thank you, Mr. Perez. Mr. Yang?
Good evening, Dr. Casera. Did I pronounce your name correctly?
Yes, sure.
All right, well, I just wanted to start by saying thank you for being here and answering all these questions, and some of them I can imagine is pretty tough. But my colleagues surely has covered some very important questions, and you have gave us some really good responses. this is our first time meeting each other. I'm actually a new elected trustees on the board. So with that said, I want to share that I'm a healthcare worker, and I have received 2 of my vaccine. That's the Pfizer as of today, and I
Good.
did not receive any side effect.
That's here.
With that said, I want to follow up with some questions. My first question would be, and mainly I want the public to hear this as well. So, are we still under the 14 days quarantine if we are contracted with COVID-19? Is that still intact?
So you bring up a good question. The CDC did reduce the amount of time. And again, want to make a distinction. If you do have COVID-19, you have to stay isolated for 10 days. If you are identified as having been exposed to COVID-19, you may not have it. Before, it used to be a 14-day quarantine period, but now it is 10 days. They reduced that to 10 days because they found out from studies that 10 days is relatively sufficient to make sure that you're not going to come down with the disease. So, and it does make it easier. So 10 days quarantine, 10 days isolation.
Great. Thank you so much on that answer. The second question I have is, you may have already answered this, but I don't recall hearing it. I know that there's 3 phases as far as I know, and the children from K to 12, it's lie within phase 2. So and if I'm not correct, please correct me. What is the time frame as you see that these children will get the vaccines?
Actually, at this time, children are not approved for getting the vaccination. So I believe
And that, what age to? Like what age?
For Pfizer, it's approved for age 16 and above, and I believe for Moderna, it's 18 years and above.
Okay. Okay, thank you. Now, there's 2 vaccine, Pfizer and Moderna. Can you tell us which one what's the difference between the 2? And is there any other vaccines that is going to be supplied to the public in the near future?
So the main difference actually is in the way that both vaccines are handled. The Pfizer requires ultra cold freezers, and so it does make the handling a lot more complicated. As I mentioned, if you take it out of the freezer, you have a very limited amount of time in which to use it up. Moderna requires just the regular freezer, but it also needs to be handled very carefully because of the way that it was made. You have to ensure that you maintain the temperatures. It can't go above or below a certain temperature. So it does, and that's why I mentioned that it makes it more difficult for us to be able to just grab a few doses, go out and do vaccines in different places. And both of them lend themselves more to being able to conduct the vaccination clinics at large places like the hospitals, like the Cal Expo, and at the pharmacies. Both of them are effective. Both of them also do need to have 2 doses. For Pfizer, the second dose is at 21 days, and for Moderna, it's at 28 days. We do know that there are additional vaccines that are being tested right now. I believe UC Davis is in the process of a vaccine trial. I forget the name of the vaccine, and I don't want to get it wrong. There's also another one, AstraZeneca. I believe it's also in the trial or going for FDA approval. So our hope is that we will have more options pretty shortly.
Okay, great, thanks. My last question, Mr. Perez did ask a question regarding, it could be similar or the same, but I just want to reemphasize on it. In regard to the Governor Newsom's proposal, with your knowledge and professional background, do you think that our Sacramento County school district is capable to meet his, I guess, resolution for bringing our school back on campus?
I believe so, but I believe that there are a couple of things that we need to work on. As I mentioned, I feel more comfortable with the protocols because those are, we have been discussing those for a long time. But the testing, as I mentioned, being able to do it at the level that the state is asking for requires a lot more, especially because Elk Grove is the largest school district. So being able to do that amount of testing every week for staff and students is a daunting task. So I do believe that that's probably what all of the discussions are about. How do we actually operationalize that? The other also is with the vaccination. I think that being able to get vaccinations for the staff will help a lot in terms of increasing the safety of the school environment. Plus also, I believe that it's one way that will actually bring down our numbers so that it will be safe enough for us to be able to open for the students.
Okay, so in short, you think that we could meet the governor's requests?
Right, but there's a lot of work. It
Right.
doesn't mean that it's easy. I don't think anyone has any illusions about being able to do this. It's a heavy lift. And that's why we're having all the discussions about how can we make this happen.
Thank you, doctor. That's all I have for you. Good meeting you.
Thank you. Nice meeting and congratulations on your appointment.
Thank you.
Dr. Kassiri, I have just a few things left. I've been Xing them out as you've been answering questions. So
Sure.
if we go back to your understanding of Cal OSHA, an outbreak is 3 or more. I don't know if you're the correct person to ask this. Do I understand that's 3 positive people at a school site means we close that school site?
No, it doesn't mean closing. It means that it triggers testing, which is like a weekly testing. But then with the school testing, since the state is asking us to do every week or every other week, it actually might end up being a moot point, because if you're already doing it, then you'll just be able to continue it. It also, Cal OSHA also requires that you report to the county, which the schools are doing already. So I think that part is an easy one. But the last thing is Cal OSHA also requires that you have to have a written protocol that you post on your website about how you handle an outbreak. But the outbreak, when to make a decision to close the school is a lot more nuanced now, because we are being told actually that they will take away some of the guidance that they had before, about 5%. And it will be based more on a discussion about, the capacity to be able to continue running the school and being able to maybe have one cohort or one classroom go on quarantine.
Okay.
That new guidance is what we're waiting from the California Department of Health that we thought might come today. And it's going to supersede all the stuff that's come up before. This is going to be the guidance. So we're waiting for to see exactly what that will look like.
Okay. Well, I can only imagine your frustration is even higher than ours with the ever moving target. So bless you. So do you have any idea how many people are in category 1A for Sacramento County?
I cannot give you a number right now.
Okay.
I can we've been looking at the different groups. I can go back and try and get that number. But no, I don't have it at hand.
Okay, how about, like, have we got half of them vaccinated? Do we think we have 10%, 20%, but we're gearing up and we think we'll finish by January? Is that more general?
Yes, our goal is to get through 1A by the end of January.
And you feel that's reasonable?
Yes, that is doable. And in fact, in our discussions with other large counties, they have the same feeling as well. Because part of it is being able to do the ramp up. And once we get providers on board, and especially also if we get enough vaccine, I think we'll be able to get through it and get to everybody.
Okay, and then 1B, educators will be in. I, at my age, Mr. Fortino, won't be in, but we will be able to send our educators for 1B. Can you give me an idea if 1A is a group of 10 people, 1B is a group of 100 people, 50 people? I mean, it's a multiple of 1A, I imagine.
It is because 1B includes all of those over 75, law enforcement, teachers, agricultural workers. That's a huge chunk. We're still trying to get a handle on some of the numbers. It's easier when you're looking at, for example, law enforcement, because we can call the police departments and the sheriff and ask them, okay, tell us how many you have. But for like agriculture, it's much more difficult. For the schools also, it's easier because we can ask you, okay, tell us how many staff. And also you can actually do a poll and find out how many of them are interested in getting vaccinated. But some of the others, it's going to be more of a challenge to figure the number out.
And how I have recently read, there's a change in attitude of saving back doses to make sure you have seconds versus dosing everyone as the first time, as many people as we can. And I imagine that's based on that provide you with like 50% facility. So should I feel comfortable? I mean, we're going to go do a first dose with all our teachers, and then in 21 to 28 days, we need to do a second dose. But if that doesn't happen on the day, I don't know the science. Does it become less effective if they get a second dose 30 days later, or that? Can you talk to that difference?
Sure, and yes, you bring up a good point. So the data that they have right now, it's not good to give it too early. So I think for Pfizer, you can't give it earlier than day 17, but there's no limit on when, if it's beyond the 21 days, when to give it. So if you give it at 30 days, it's just as effective. And I don't know if there's a limit on the other end, but that's part of the reasoning behind saying, let's get as many people with the first dose as possible. And then even if we're a little late on the second dose, it's not going to cause any harm, because the first dose also does give relatively good protection. I've heard anywhere between 50 to 70%.
Okay.
So I think that is good for one shot.
Okay. And then there's a frustration that I just want to recognize, that if the new number is 28 per 100,000 and the old number was 7, we could have had school open a while ago. But so I just want to recognize that frustration with the public and that moving target. And have you been shown science that changes that, or that sets that point, or we have just not gotten that information yet?
We have not gotten that information, and yes, I do hear the frustration. It's been hard for us also to having to adjust with the changing guidance, but I guess what I want to remind everybody of is that no one has had to deal with COVID-19 before. We're all learning as, at the same time, basically building the plane as we're flying. And so we do need to give some grace and some room for making changes to guidance. Because at one time, if you recall, we shut down schools right away because everyone was concerned about children, because usually, for example, when you look at the flu, it's the very young and very old. But we're seeing what it was doing to the very old, and we're like, oh my God, we got to shut down the schools because we don't want kids to die at that rate. But then as we started opening, we're realizing, okay, the numbers are still remaining low. And yes, there is some risk to the staff, so we still need to make sure that the schools are safe enough. But as we've come along, I think they've been looking at ways of, because of course they're also conscious of the impact that having the schools shut has had on children and their families as well, in terms of a lot of the parents are very concerned about how far back the kids have fallen, especially for those that are very much more dependent on being able to get feedback from their teachers. Being on Zoom is not that easy for everybody. And some kids just being able to focus is not as easy if they're doing it at home. So all of us are very aware of the challenges of having this distance learning, especially for the younger children. So looking for ways of, okay, how can we do it, even though our numbers are still not back to the 7 per 100,000, how can we do it? And so that's why they came up with this new guidance of saying, okay, let's make it 28, but in addition, testing every week or every other week, because then you're able to catch people who are positive a lot sooner than if you're just doing it once a month or every other month. And then also, again, with the fact that we do have the vaccine coming along, and hopefully as soon as possible being able to get the staff vaccinated, even if it's just one dose to begin with, that's still a lot better protection that we have right now. So the environment is different from what we had before, and that's why we have to be able to adjust to the new guidance that we're given. I know it's hard, but I think the goal that we all have is to be able to, as soon as possible, be able to open schools so that students can have in-person learning.
Well, I just am going to share a quick thing. Someone told me that this is like trying to keep air out with a piece of Swiss cheese. So there's always some holes, but the more layers of Swiss cheese you put on, the better protection you get. So
there you go. That's a good one.
So visionary to me that it just started making sense. Like, wear your mask, stay 6 feet. And so we're learning what those layers are that require to keep us safe. And I greatly appreciate your statement and your attitude to, we are figuring out what we need to get to schools open, because that is our goal. So thank you so much for your time.
I have one more question regarding the new virus mutation. Who's at the forefront of that study and how it affects communities? Like, for instance, I know they say it's here in California, but yet, and it's easier, contagious and all that. So I was wondering what's happening in that arena.
The CDC and the state are working on that, and it does require specialized machines to be able to do what we call the gene sequencing. Basically, it's like a fingerprint of virus. So they're working on that.
So as a result of that, I'm wondering if it mutates, would it affect children or students, younger children, than it would, or would it just easier to affect everybody? And there hasn't been no studies on that. So I'm wondering about that issue. That's in my head,
Yeah, so far there's no evidence of that. We do know that it spreads more easily. We are also told that it actually seems like the vaccine that we have is still
works
as well. So those are two good things.
Okay, thank you very much again.
All right.
Thank you very much. Mr. Hoffman, did you have anything else to say?
No, just thank you so much, Dr. Kassiri. I know it took 2 hours of your life when you don't have 2 hours to give. And and we appreciate it so very much and look forward to you as we work through this new phase, as we got a lot of work ahead of us. So thank you as always.
Sure. All right, thank
Doctor,
you.
Be
Doctor,
well.
I'm sorry. Can I ask you a quick question?
Sure.
Just a quick question. How long does it take for the vaccine to be affected?
Effective.
As I mentioned, after the first dose, you get about 50 to 60% effectiveness. We're told that it takes
No, I
about
mean, like, how the time, like, do you get protected like right away when you get the shot, or a certain amount of days, or
probably a few days before you
days?
start seeing any impact. But the full impact is 2 weeks following your second dose. So that's why that's when it goes over the 90%.
And how long does the vaccine protect you?
That
Like
we
2
don't
year,
know
2
yet.
year?
That we don't know yet. As
Okay.
I said,
Thank
I
you.
think that's part of the plane we're building.
Thank
All
you.
right. Thank you. It has been a wonderful, informative 2 hours. I would like to call for a 5-minute comfort break, and we'll come back and get smoking on this agenda. Okay, we have 5 minutes. I will fully admit I forgot to set a timer. I think I have everybody though, so we're good. Oh, Mr. Yang, are you with us? We'll wait till we get him back, at least for a few minutes. Oh, okay.
I thought you were gonna model doing a meeting with a mask on there for a second.
Well, I was having my temperature adjusted. Someone was in the room. It gets very cold in here fast. And it gets hot fast.
I missed
All
that.
right, we're ready to go. We're going to move on to item number 2, high school student representative reports. Best part of the night, Mr. Murray.
Thank you, President Albiani, members of the board, Superintendent Hoffman, and Ms. Avalos. Tonight we have our recorded sessions from our students from Cosumnes High School and Sheldon High School. And at this point, I'd like to turn it over to Tremaine so he can guide us through our presentations.
Good evening, Board President Albiani, members of the board, Superintendent Hoffman, and Ms. Avalos. My name is Nansara Shergill, and I am representing the Mighty Wolfpack. CSF and NHS tutoring has been going strong in our virtual environment. Students seeking help in math, science, English, and history have been attending tutoring sessions online with our lovely volunteers. Also, our wonderful counselors have provided virtual college application tutoring sessions for our seniors. Hundreds of our seniors have participated in these workshops and gained valuable information on the college application preparation process. In our music department, 2 students achieved very high honors by being appointed to the All-State Symphonic Band, which is the second highest all-state band, and to the All-State String Orchestra, which is the highest all-state string group. This year, we have put an emphasis on mental health awareness. Our student ASB team have created a mental health initiative at our high school called Mindfulness Mondays as a response to the need of mental health resources on campus during COVID-19. We create new videos, quotes, and tips which are posted every Monday on social media, our school website, and sent in school-wide emails to parents, teachers, and staff. It has been rewarding to see so many students and families enjoy our video clips and unique quotes. We have also integrated our social emotional learning lessons into our class time every Wednesday, and have had fun, engaging, and meaningful activities with our peers. The feedback from students has been very positive in using this time to help ground them in the distance learning environment.
Hi, my name is JC Negosic, and I'm a junior representing Cosumnes Oak. Our year started off with the Spirit Week and our Disney original movie themed Homecoming. Monday was Descendants dress to represent the theme of our freshman class. Tuesday was Teen Beach Movie, where students dressed up as bikers and surfers for our sophomore class theme. Wednesday was Camp Rock dress to show off the tie-dye theme of the early 2000s for our junior class. Thursday was High School Musical dress, where students dressed in East High red and white for our senior class. And lastly, Friday was CO Spirit, where students got to showcase all of their class spirit wear. We also did a Disney Channel original movie themed Kahoot, door decorating competition, TikTok challenge, and at-home Disney movie night with popcorn, all for homecoming week. Despite the circumstances, our ASB class has presented a school year jam-packed with events for our student body. We had a Halloween scavenger hunt, our Pumpkin Palooza pumpkin carving contest, a pet dress-up day, Breast Cancer Awareness Pink Out Day, our Thanksgiving handprint turkey competition, Winter Spirit Week, Winter Bake Off, and just last week we had a Lorax Netflix movie night. Our students have had such a blast participating in all these newly created activities. And it's been more than just our ASB class planning events. Our Thespian Troupe and Wolfpack Performing Arts presented their virtual winter showcase with monologues and songs. This event was a great opportunity for students to showcase their talents and represent the Wolfpack's outstanding performing arts program. All of our athletic programs have unfortunately been postponed until further notice given by the state, but we're looking forward to such a strong return from all of our teams next year. Thank you for your continued support, and remember that the strength of the pack is the wolf, and the strength of the wolf is the pack.
Good evening, President Albiani, members of the board, Superintendent Hoffman, and Ms. Avalos. My name is Divya Chauhan. I'm a senior at Sheldon High School.
And my name is Hannah Core, and I'm also a senior at Sheldon High School. This is our interesting way to share what we've been doing at Sheldon, and we're excited to share that we have a lot to report. In terms of academic achievements, even with coronavirus slowing down our activities, school life has continued for our students. Many of our honors programs, including the California Scholarship Federation and the National Honor Society, has continued to meet weekly and participate in virtual community service projects, such as the St. Jude e-card event, which is an inter-club social with Monterey Trail High School through Zoom. In addition, to help our students, the Sheldon Counseling staff has created a virtual office where students can go and access mindful resources and other helpful links. They've created a Google Classroom for seniors to stay caught up on college information and questions. In addition, our counselors creatively came up with the Counseling Cafe, where they are available bi-weekly for students to get on a Zoom call with the counselor based on their needs and for support and assistance. Lastly, our College and Career Center has been working hard to stay connected with students and providing updates on college and career information and updating the Google Classroom daily. Our counseling staff continues to do an amazing job providing information to students so they can achieve academic success and get answers to questions during this critical period of their lives. In November, we recognize our students' academic success from quarter 3 and 4 of spring 2020. Our wonderful vice principals and ASB students took the time to create recognition videos for each grade. The number of students excelling in the classroom remains high, even with distance learning, and almost 700 students earned a 3.75 GPA or higher during the initial start of distance learning last spring. In terms of student unity efforts, to keep students connected and up to date on school news and current information, ASB has been creating weekly announcement slides where teachers post in their Google Classrooms at the beginning of the week. In addition to spread positivity, ASB continued random acts of kindness cards by creating a Google Classroom presentation for each class with a positive message for each student on an individual slide. Through this, we were able to bring smiles to the faces of many students. Because of coronavirus, our athletics program had a slow start. However, before winter break, our activities began to pick up. Football, basketball, baseball, cross country, and cheer had begun to do small group conditioning sessions to get prepared for their seasons. To ensure our student safety, Sheldon has employed strict social distancing rules for sports and only allowing groups of 10 or less on campus, while mandating masks when not in motion. With the current changes, sports have been put on hold and hope to begin soon when things are safe. We would like to recognize Sheldon's softball program as they were recently recognized as the number 6 softball program of the century by Cal High Sports. We are eager and hopeful to see how our Sheldon team performed this year.
Unfortunately, many of our usual fall events have been canceled or postponed. However, that hasn't stopped our school's ASB from hosting and promoting alternative student events and activities geared towards distance learning. With some heavy modifications, Sheldon ASB still held the homecoming rally. The rally was uploaded to YouTube and created while following social distancing guidelines. This year's rally still included involvement and participation of staff members to help announce our homecoming court, as well as a few sports team introductions, performance by our band, cheer, and our dance group, Universal Rhythm. In the past couple of weeks, Sheldon has had multiple virtual spirit days where students could earn recognition prizes by taking pictures of themselves dressed up. Some of the days included TikTok Day, Wacky Wednesday, and more. In an effort to make it more accessible, ASB had students submit their outfits via Instagram, tagging ASB in their story or below their posts, or submitting them to a Google form provided by ASB. While the experience was definitely different from in-person spirit days, it was a refreshing way for students to stay spirited. Additionally, many of our school clubs have adjusted to the social learning model and have continued to remain active even during these difficult circumstances. In September, our school presented all clubs by having them create an informational graphic for students to get more information and interest from. These were then posted to our school website and promoted throughout the beginning of the year. Since then, our club have continued to meet regularly online via Zoom or Google Meets. Also, our ag program was recognized in November as an outstanding small program in the Sacramento section. Way to go, Huskies! Our BABA department has been busy planning events and trying to keep up with their performances and productions. Our Sheldon TheaterWorks program has produced 2 new shows, Underneath the Dark Side and Awaiting Santa. Both shows were produced via Zoom and written and directed by students. They are accessible to everyone on the official Sheldon TheaterWorks YouTube channel. The instrumental music department had held a virtual concert over Zoom in December, which featured students of all performing ensembles: jazz band, orchestra, concert band, symphonic band, and drumline. They also featured artwork from some of our virtual classes on campus. President Albiani, members of the board, Superintendent Hoffman, and Ms. Avalos. Thank you so much for your time this evening. Sheldon has been trying to do their best with these unforeseen circumstances, and we hope that with the new year, you can offer more to our students.
Excellent. Thank you so much. Well, next we'll move on to resolutions. Our first resolution is Black African American History Month. Ms. Pinkerton, is there any public comment related to this item?
Madam Board President Albiani, there are no public comments related to this item.
Thank you. Mr. Cerruti?
Thank you, Madam President, and good evening, members of the board, Superintendent Hoffman and Ms. Avalos. It is my pleasure and privilege to bring before the board a request for the board to consider the approval of resolution number 32, designating February as Black African American History Month. This resolution celebrates efforts and achievements made by Black African American individuals, which have benefited all of society. This observance encourages the society at large and schools in particular to celebrate the achievements of Black African Americans and also to re-examine society's role in preserving the civil rights of all of its citizens. Although the study of contributions in the literature about and authored by Black African Americans is part of the curriculum throughout the year, this designation in February adds special emphasis. Elk Grove schools have many special events during Black African American History Month, in addition to activities and classwork that occur throughout the year in accordance with sites and departments' student unity and diversity goals. At the elementary level, the Black African American history activities are integrated into classroom discussions, art projects, social studies, and language arts. Examples from our adopted curriculum include A Great American Teacher, a biography about Mary McLeod helped many Black African Americans get an education, as well as Delivering Justice, a biography about one man who became a civil rights leader in his community. All elementary schools include the study of influential Black African Americans. At the secondary level, some specific pieces of Black African American literature include Beloved, Black Boy, I Know Why the Caged Bird Sings, Native Son, Raisin in the Sun, and Their Eyes Were Watching God. History social science teachers engage students in discussing and learning about the history and contributions of Black African Americans in the United States and the world. And with that, I respectfully request the board give consideration to the approval of Resolution 23 designating February as Black African American History Month.
Thank you. I'd like to call for a motion to adopt resolution number 32.
I have a comment or amendment. I'd like to add that we could add, whereas this board supports Black Lives Matter. I'd like to make that amendment to this resolution. Black Lives Matters.
So you've made a motion for an amendment?
Yes.
There is an motion for the amendment. Is there discussion?
I'll second.
I'll call for the vote.
Mr. Fortuna?
No.
Ms. Charis Espinoza?
Aye.
Dr. Martinez O'Leary?
Aye.
Mr. Perez?
Aye.
Mr. Yang?
Aye.
I will vote aye. We will add that as amended, a motion to adopt resolution number 32 designating February 2021 as Black/African American History Month.
So moved.
So moved. There's a second.
Aye.
A first by Nancy Charis Espinoza, second by Mr. Perez. All in favor? Mr. Yang?
Aye.
Mr. Perez?
Aye.
Dr. Martinez O'Leary?
Aye.
Dr. Charis, Ms. Charis Espinoza?
I'll take the promotion. Aye.
Mr. Fortuna?
Aye.
Thank you. And
Just to be
myself,
clear,
it's unanimous.
Thank you,
Just to be
Mayor.
clear, we'll make an adjustment to the resolution itself, adding a line to include the statement.
Yes.
Okay.
Number 2, Career Technical Education Month Resolution. Ms. Pinkerton, are there any public comments related to this item?
Madam Board President Albiani, there are no public comments related to this item.
Thank you. Ms. Ross?
Good evening, and thank you, President Albiani, members of the board, Superintendent Hoffman, and Ms. Avalos. Tonight, the Board of Education is asked to approve resolution number 35, designating February 2021 as Career Technical Education Month. This observance allows us to celebrate the contributions of career technical education as a vehicle to provide our students with high-quality college, career, and life preparation. The Elk Grove Unified School District offers its students a broad spectrum of CTE opportunities, beginning with middle school exploratory programs that lead to high school introductory, intermediate, and advanced courses. Students also receive CTE training through the district's Explore CTE program. Elk Grove Unified School District CTE programs are considered exemplary throughout the region and state. This resolution affirms the work of district staff in continuing to provide students with educational and workplace opportunities beyond those found in traditional instructional models. At this time, we respectfully request the board consider the approval of this resolution.
Thank you. I'd like to call for a motion to adopt resolution number 35, designating February 2021 as Career Technical Education Month.
I move resolution 35.
I'll second it.
Second that.
But first by Mr. Forshina, a second by Mr. Perez. A roll call vote, Mr. Yang,
Aye.
Ms. Charis Espinoza,
Aye.
Mr. Perez,
Aye.
Dr. Martina Salir,
Aye.
Mr. Forshina,
Aye.
and myself. It is unanimous. Thank you. We're moving on to public comment submitted electronically by 4:30 p.m. TU Day. Ms. Pinkerton, would you please read public comment for items not on the agenda and related to closed session?
Yes, Madam Board President Albiani, I'll be reading the public comments. Are there any other guidance that you'd like to provide, or simply read them?
I believe we have enough public comment to reach within a 20-minute time frame. Ms. Martina Salir, will you please be sure in time? Thank you.
All right, the first public comment comes from Felicia, and this is regarding opening schools. Please reopen our schools. Many schools have opened safely and are still safe. Please look at the safety procedures of schools that have opened, like the private schools in Elk Grove. There is no reason students who can afford private school can get in-class learning, and students who can't afford it should still be distant learning. There is a safe way to open and stay open. Use science and real data, not fear, to make your decisions, please. The next public comment is also, I'll read the ones that are regarding open schools, and then followed by 3 that aren't related to opening schools. This next comment is anonymous. Please consider reopening schools as soon as possible, even in a hybrid format. My children are so demoralized, and getting them to log on to Zoom in the morning is becoming a battle. I won't fight much longer, as this is affecting the quality of our family's culture. Please don't interpret that 30% go back number as a legitimate comment on who wants to go back. The number was in response to a stilted and inconsiderate plan that offered very little change from the feeble learning that they are getting now. Many parents are wondering, why other districts can go back and EGUSD can't. It's becoming increasingly clear that the deciding factor is the relative wealth of the stakeholders, which is discriminatory. If you truly serve students first, as your mission statement claims, you would know that the classroom is the only place to truly establish equity, which is lacking in all of your decisions thus far. The next comment comes from Cara Gomez. Dear Superintendent Hoffman, I implore you to get our children back to in-person. I want my fun, happy child back. She's struggling with the computer that kicks her out 15 times. We've thrown money and every solution at this problem to no avail. To the distractions in the house, nobody understands the holdout. Other schools are getting it done. Please figure this out. The next comment comes from Ellie Hansen. I am a teacher in the district. I am also a parent of a child in the district. I see both sides and I understand both perspectives. If I didn't have a child in the district, I could very easily tell myself that distance learning is working for all kids. Well, it is not. I see firsthand how closing our schools is hurting our kids, our future. I want to go back now. There are many teachers just like me. There are many teachers who don't want to return until it is safe. There are also families who want to come back and families who don't. Let's match them up and get busy. What to stay teaching via distance learning. Do it. There are plenty of kids who will stay home. Want your kids back in school? Do it. There are plenty of teachers willing to go back. If I had no child at home, I might actually be able to convince myself that full distance learning is going fine. I am doing a hell of a job and the kids who want to and are able to learn are. But I see the depression, anxiety, and hopelessness firsthand. It is very difficult when you are looking at it through a computer. We say we care about social emotional health. Let's start acting like we do. I have one student who admitted to me that he has gained 57 pounds. Yes, you heard that right. Why? He is depressed and feels hopeless. Yes, I know if I go back, I won't get to see my parents and I will have to make other sacrifices. I get that. I think our future generation is worth it. As leaders for our district, get us back out. At least let those of us who want to return. The next comment is anonymous. As a mother of an ADHD 9-year-old, for all the parents of children who are suffering with distance learning, please open schools for in-person learning. Children are not having adverse symptoms and teachers can be provided the proper accommodations to be safe. This has gone on too long and a majority of other districts have opened safely. The next comment is also anonymous. It has now been 10 months since our children have seen the inside of a classroom. I have watched my 8-year-old daughter or 8-year-old son go from outgoing, playful, energetic to depressed, angry, and no motivation to learn. I know he's not the only one. He lives in a loving, stable home. What about all the other children who don't have a stable home life? If anything is essential, it's school. Why are most other school districts open with modifications and EGUSD isn't? We deserve more. Our kids deserve more. Our kids absolutely need to be back in school for their mental health and well-being. We're tired of excuses. Do something, anything. Distance learning is not working for many of us, and we should be given a choice. The next comment comes from Megan Harper. If you look to nearby counties, their schools has resumed in person with very little issues. Why is it I can drive less than half an hour away, half an hour out of the district and the schools are in person and Elk Grove Unified isn't? The virus doesn't know to avoid some districts and to go to others. I've watched my children through this go from happily learning to achieving a barely rolling out of bed to log in and not learn. I spend 6 to 7 hours a night teaching them after work what they should have been taught in class because they can't see the small type on the Chromebooks and the teachers can't teach effectively via them. The worst is hearing teachers brag of their travels and locations while teaching. The teachers who are afraid to be in the classroom with kids they monitor have no fear of getting on a crowded airplane with strangers and traveling to destinations. The kids need to be in school. I can't, as a parent, bear to see the demotivation that has happened with the kids while in the mode of instruction. The next comment comes from Sarah Nguyen. I have 5 students at all ages currently in Elk Grove Unified School District. 3 of them have current IEPs. Today I had an emergency IEP meeting with my youngest 3-year-old with autism per my request. I tried Zoom meetings for a month, but when my first grade returned to class in December, I could no longer do it as it requires 100% participation from me as a parent who also works full-time handling workers' compensation claims, currently working remotely since COVID. My son is not getting the services he desperately needs. Why can't the district come up with a plan like other districts? Why has it been almost a year with no concrete plan? Why must we sit back and watch other districts return while ours has no date in sight? You have had more than enough time to come up with a plan and actually go through with it. When given the okay mid-October, you took 2 weeks to provide a plan and it never happened. Our children deserve more, and we as parents will no longer be silenced. Our children are what makes this district and gives teachers students to be taught. They need their teachers and instruction and fellow peers for learning and mental health reasons. Please help our children return to class in person. The next comment comes from Scott G. Please reopen all schools now. We are not at base a safety first nation. Yes, for short periods of time and under extraordinary circumstances, we might choose to put our collective safety above our collective liberty, but not for long. Never to this degree, and never at the behest of leaders who peddle policies with no rhyme, no reason, no sense of fairness. This is not sustainable. Distance learning in the absence of social interaction is devastating our children's future. Lives are being destroyed now and forever every day. EGUSD remains closed. EGUSD must dissolve all fear and do better for this community. This takes courage. Any board member, staff, faculty, or teacher who doesn't possess such courage should resign now, tonight. Our community and children deserve better. The next comment comes from Anna Osborne. Mr. Hoffman, I am heartbroken to even have to be writing this letter, as I believe that the voice and needs of our children have been completely forgotten by the board and the teacher unions. You have not done what is best for our kids by not opening our schools. I completely accept there are a number of families that do not feel it is safe for children to return to school, and yet the large number of families that see the science and know that exposure is not occurring at schools is being ignored. I have nieces and nephews in Rockland, Roseville, and Lincoln, and their districts have all found a way to create return to school options for families that wish to return and those that do not. You have failed at this. You have used excuses around orange tiers, being too large of a district, and safety to hide behind your failure to our children. Our children count on the grown-ups in their lives to look out for their best interests, and you have failed to do this. Our children, you continue to hide behind unscientifically based decisions, refusal to apply for state waivers, and offer only excuses for why a return to school can't be done. And that is unacceptable. As a parent and mental health professional, the risk you have put our children at by not opening schools is unimaginable. My greatest fear is you haven't even begun to realize the risks our children are at by being taught remotely. I fear that bullying, suicidal and ideation, gun violence, and depression, anxiety are devastating risks that you have ignored on behalf of our children, and that you have had numerous opportunities to make it right and have failed at all of them. Our children need to be back in school now, not tomorrow, not in August, but now. The needs of our children are being ignored by your inability to open the schools to be accountable of true devastation you are causing in their lives. They need their friends, their teachers, their education, and you're neglecting them. Distance learning is a sorry excuse for the mental, academic, and emotional needs. You need to open the schools for these children. You are letting them down and are answering to no parents that want our children back in schools. You should be disappointed in your leadership. The next comment comes from Lisa. DL, distance learning, has negatively changed my children and our household. My kids are sad, angry, and constantly irritated. They cry over school daily. They use terms like, I hate school. Can I skip today, please? DL has made them needy. They are so miserable that they will grasp onto anything to have other kids around. Unfortunately, that is mostly online. Video games and FaceTime, AKA more sittings, more screen time. My kindergarten asked me what I thought her school looked like because she's never been there, ever. Can you imagine her poor teacher trying to inspire kids that don't even know what non-preschool is? And she cried that she is never going to make friends. COVID is not a childhood disease, but keeping them out of school is causing so much mental warfare that it will have long-term effects. Children's brains development is dependent on the influence of other children their ages. We know that as a fact. I am begging of you to let my kids back to school because as a parent, you want nothing more than to protect your kids and help them feel better. This will change everything for them. Let them back. The next comment comes from Rob Osborne. I strongly urge this board to take a more aggressive approach in a return to school model. Most other school districts in our surrounding area have been able to find an option for an in-school learning. I understand some families prefer the at-home solution, but my family does not. I simply cannot stand by silently and watch my children and friends' children suffer any longer. They need the socialization and time out of the house. They need to play outside with other children. I'm very disappointed in the inability of this board to see the obvious needs of its students and deliver an option for these families. I implore you to seek advice from other districts that have successfully built a dual model for their students. Get it done. The next comment is anonymous. We decided to take our children out of EGUSD and opted for private school. We would like to re-enroll, but will not unless they are back full-time in-person learning. We are doing irreparable damage by keeping kids in distance learning. Distance learning does not work. The next comment comes from Karen M. As the survival rate of COVID-19 continues to be extremely high, and despite health experts agreeing that children are low risk for getting or transmitting the virus, you continue to advocate for keeping schools closed, causing more harm to our otherwise healthy children. Every child expert for the last decade has warned about the dangers of too much screen time in young kids and its impact on brain development, fine and gross motor skills, and for everyone, its linkage to obesity and short attention spans and decreased ability to read emotional cues from other people. Distance learning isn't just a waste of time. It is actually doing harm to children. And worst of all, it is those we have entrusted with their safety that are putting it in jeopardy. Kids are safer in the school, building immunity, exercising, engaging, growing, learning. Your continued decision to not support a return to school is causing depression, obesity, drug use, anxiety, and other physical and mental health issues. All these are very real public health concerns and real statistics, yet overlooked by COVID case numbers of demographics, which has little to no effect on these school-age children. Please be transparent and provide data that actually shows kids are healthier mentally and physically while distance learning. If not, bring our kids back to school full-time and stop damaging their health with distance learning. The next comment comes from Deborah Shook. I would like to take this opportunity to express my concerns regarding the impact of distance learning on the students of EGUSD. I have 3 grandchildren with IEPs, and the current approach is not working for them or meeting their full educational needs. For example, one of my grandsons spent many hours and a lot of hard work to make marked improvements to his test scores. He was recently tested and his scores dropped by nearly 200 in just the last year. Please understand how heartbreaking it is to see him struggle trying to navigate this process. And not only is he failing, but he actually regressed. I could go on with other examples of the impacts to progress of their education, not to mention the social impacts, but the true point is, what is your plan to address the very real issues that all children are facing? It is unacceptable to see children continue to fail. The current process and programs are not meeting the educational needs of students, including social needs. Changes need to be quickly made and communicated clearly with transparency. The next is an electronic email that was submitted by the EGUSD Parent Coalition regarding Elk Grove Joint Unified School District reopening. Dear President Albiani, Superintendent Hoffman, President Stansel, members of the Board of Trustees, we're writing you as the EGUSD Parent Coalition as a follow-up to our meeting January 8th, 2020, which was in response to our December 11th, 2020 letter regarding Elk Grove Joint Unified School District reopening. Thank you for the audience with Superintendent Hoffman and his staff, who presented responses to the questions we posed around reopening schools for in-person learning. The EGUSD Coalition and the parents, students, teachers, coaches, staff, medical professionals, and concerned community members who make up our organization have follow-up questions, concerns, and requests. The coalition would like to read into the record and this issue taken up by the board in the January 12th, 2021 board meeting that is consistent with decentralizing the current decision-making process, increasing transparency from the board, and to be more inclusive of the public in the reopening plans and the business of the Board of Trustees during this pandemic. EGUSD Parent Coalition formed to represent the community's overwhelming desire to safely reopen all elementary, middle, and high schools concurrently, provide parents a choice between in-person instruction or continuing with distance learning, and provide students with special needs access to in-person instruction as soon as possible. One request is to work in collaboration with the board and staff to form a full reopening plan committee that is inclusive and driven by a fair and legal process where the public can be involved and provide input, attend committee meetings, seek public comments, and there can be deliberation that is expected in a representative democracy. By suspending the Brown Act by executive order, we are concerned that the procedural requirements of a virtual board meeting format is not consistent with a democratic and representative government. Thus, our coalition requests that the Board of Trustees form a committee that addresses public inclusion, specifically the voices of parents and students. In addition to our request to form a committee with public inclusion, we have additional questions and concerns centered on the following areas as a result of our recent meeting with Superintendent Hoffman and his staff. Elk Grove Unified School District's continuation of only offering distance learning shows a lack of leadership among our regional district peers who have reopened. This drives a lack of confidence from the community in the EGUSD and its leadership. It is our desire to work with the board to be a leader of the greater Sacramento region and the state in returning to in-person learning. Our coalition partner districts, private schools who are offering both in-person instruction and distance learning took advantage of the waiver process and presented return to in-person learning plans. As a result, we are losing students at a high rate, which could result in permanent losses to our district. We seek data and evidence that distance learning is going well as reported in our meeting with district leadership. We agree that distance learning has improved since the spring of 2020. Teachers have put forth a tremendous amount of effort in teaching our children through the distance learning platforms. However, we assert that the survey.
Time.
Okay. All right, we've given this subject 20 minutes. Can we read the last three on a different subject, please?
Excuse me. Zante was in the middle of a letter that was sent by the coalition. I request that we finish the letter instead of stopping midway through that letter.
All right, we will finish the letter. And Ms. Pinkerton, in the future, can we read that letter first if we have one from them?
Sure. However, we seek the data and evidence that distance learning is going well. As reported in our meeting with the district leadership, we agree that distance learning has improved since the spring of 2020. Teachers have put forth a tremendous amount of effort in teaching our children through the distance learning platforms. However, we assert that the surveys do not adequately tell this full story of what families are experiencing with distance learning. Although we have heard success stories, we have also presented serious cases of the negative side effects to our children that could have decades-long impacts to our youth and our entire community. We have yet to witness the long-term impacts of learning loss and the increasing socioeconomic disparity this is creating in our community. The community wants to understand how the district is measuring the success of distance learning and the overall health and well-being of our students. At-risk students, foster and homeless youth are currently on campus, yet students with an IEP and 504 and other high-risk populations do not have an in-person option despite documented requests for in-person learning. Because our district chose not to enter into the waiver process, we are legally jeopardizing the education of our students. Even in the more rural schools, we struggle with why there is not an in-person choice for our most at-risk and vulnerable populations, as allowed within the tier system. The reference to the survey data that most families do not want to return to in-person learning is a flawed process and not a valid basis for reasoning. Because the surveys offered limited options for hours of instruction and no transportation, it assured a specific result. There are a substantial number of parents, students, and teachers who do want to return to in-person learning. Again, we propose to co-develop a more reflective and reliable survey, which includes the coalition's experienced data analyst to compare results so the board can accurately be informed. The district does not have a full reopening plan in place that represents public input and participation with target dates, benchmarks, and goals. We do understand the step 1 plan Mr. Hoffman and staff presented, the concurrent model that is now hindered by case rate data and the lack of a waiver submission. This coalition believes that our data driven by our medical advisory board and the other government case data, including CDC, dictates that schools should be open for in-person learning. This lack of a full return plan propagates uncertainty and distrust in our leadership from the parent, student, and teacher community. Our expectation is that the board can make better decisions for our local community than has been made to date. We want to work in collaboration to develop a full return plan with an option for distance learning that is safe and equitable, starting with our most at-risk populations. Vaccinations are the new focus of the superintendent and the staff, and we are not opposed to that focus. The coalition and our medical advisory team have science-driven expectations in this regard and request to be able to have input on that initiative and an opportunity to present our facts and findings in the form of public testimony. Our goal tonight is to move beyond communicating with the board by participating in the development of a return to in-person learning plan that is equitable for students in the form of a committee. We ask that the board make a motion to do so, and if the motion passes, we pledge to further the recommendations we have made to date and provide assistance to the district in a safe and effective reopening. We greatly appreciate the hard work of district staff and the Board of Trustees to move to a distance learning model in response to the COVID pandemic and to care for our students, as well as evaluate the path of a safe reopening. We further are indebted to our teachers for their work during such unprecedented difficulty. We look forward to working with you in the form of a committee to develop a reopening strategy that works for all. Sincerely, the EGUSD Parent Coalition, representing over 600 families and over 2,000 students. The other comments that were submitted are brief. The first one comes from the Montessori Project, Mickey Slamkovsky. Good evening, Superintendent Hoffman and members of the board. My name is Mickey Slamkovsky. I am the principal at the California Montessori Project, and I'd like to share our regular Montessori Minute with you. We continue to collaborate with our families and staff regarding the next phase of our educational experience. In anticipation and preparation for when we can safely bring our students back on campus, public health conditions permitting, we were able to assign all students to either a distance learning or hybrid instructional model based on our families' preferences. Many of our special education students have been coming onto campus for their services, and that transition has been going smoothly. We also administered the second iReady diagnostic assessment to our students and have been analyzing those results and providing additional support for those students in need. Thank you. This next comment is specific to special needs. I'm extremely disappointed in the way the EGUSD is providing for our special needs children. I have 3 children on IEPs, and this comes from Anissa Wallace. In the EGUSD, one in 6th grade, 4th grade, and kindergarten. Distance learning is not working for them. My 6th grader had a Lexile score of 600 at his last IEP meeting last January 2020. His current Lexile score is 423. He is failing grade level math. His teacher and his learning center teachers are doing everything they can to help him, but special needs kids need in-person learning. It is extremely difficult to teach a child with a learning disability through Zoom. I tried to give the district the benefit of the doubt and put my trust in distance learning, but this has proven that this method is not only making my son fail, but he has regressed. This is extremely disappointing and is a direct effect of the district's not accommodating to special needs children and refusing to come up with a plan to allow special needs children to have a safe in-person learning, as many school districts have done. My kindergartner has autism, is no paraeducator, and is being denied quality occupational therapy and speech services. Are there services? Yes, but it is impossible to provide these services efficiently through Zoom. A speech therapist cannot provide quality services without correctly hearing and interacting in person with the child. An occupational therapist cannot provide services to a child without an adult to help the child with activities. Because of this, the district has forced me to become my son's teacher, paraeducator, and occupational therapist. I am not a trained professional. Luckily for my children, we are fortunate enough that I can be a stay-at-home mom to try to accommodate them, but most families do not have that option. The Elk Grove Unified School District is failing our special needs children, and because of that, our children are failing. I will not be silent any longer until the district steps up with a better plan that meets the needs of our special needs kids. And the last comment has to do with distance learning. This comes from an EGUSD teacher. Members of the board, once again, you will be barraged this evening with letters from angry parents who do not seem to understand that COVID-19 is serious and that teachers are not first responders nor babysitters and can and are completing their work remotely. As you know, it is nowhere near safe to return to campus, and community spread would be huge if we were to return to campus anytime soon. I understand the district is vast and infection rates vary greatly between our different neighborhoods, but seeing the heinous and vicious posts from the new EGUSD Parent Coalition is disgusting. They call teachers names and think we are not working. Oh, how wrong they are. These people want to bully their way into opening schools and have no regard for teacher and community safety or for the neighborhoods in our district, where rates of infection are extremely high. My students are doing well. They attend school on Zoom and engage in class. They do not want to return to school because it is their families and their neighborhoods that have been heavily impacted by the pandemic. They see the need to stay home, and it's frustrating that parents in more affluent areas are disregarding these facts and only thinking about themselves. Please continue your brave decisions and keep campus closed and community spread down. Sincerely, a teacher who is working harder than ever.
That's it, right?
Yes, ma'am.
Thank you, Ms. Santi. Our next items are consent agenda. I'd like to call on Ms. Pinkerton to read public comments related to the consent agenda.
Excuse me.
Yes.
There is a couple of those issues that were brought to our attention, I think, in need immediate services. For instance, that one student that gained 50 pounds. I think somebody should be knocking on that student's door to provide some type of services.
Mr. Perez?
We'll follow up with all the public comments, Mr. Perez. We do that. We have a meeting set up first thing tomorrow morning. We'll follow up on them.
So when did we actually receive that letter? It should have been the day that we received that letter. There's a lot of issues that
Showed up today.
that are.
We got it today, Mr. Perez.
Got it today.
Hours less.
We got it today.
Thank you.
Appropriate district staff can follow up with concerns as always.
Thank you.
Okay, Ms. Pinkerton, no comment on consent agenda?
Madam Board President Albiani, there are no public comments regarding the consent agenda.
Thank you. I'd like to call for a motion to approve items 1 through 11 on the consent agenda.
I'd like to pull items number 6, 7, and 8.
Okay, I'd like to call for a motion to approve items 1 through 11 minus items 6, 7, and 8.
So move.
Move.
Moved by
Approval.
Dr. Martinez-Solir, seconded by Mr. Fortuna. We'll do a roll call vote. Mr. Fortuna?
Aye.
Ms. Charis Espinoza?
Aye.
Dr. Martinez-Solir?
Aye.
Mr. Perez?
Aye.
Mr. Yang?
Aye.
And myself, that's unanimous. Mr. Perez, you had a question about number 6?
Yes, I'd like to make a recommendation that that we will have a state preschool presentation on this new contract and also CARES monies that are possibly combined to service our community. I understand that we are helping our teachers and faculty and staff at different schools, but yet, you know, this is a new contract and how that will affect our present programs if we are going to expand under the CARES Act with this contract, how we blend that in together, please.
Okay, I can't get you a presentation today, I can have Mr. Hoffman follow up with you, and we can send a board communication that makes it clear after your meeting.
Would other board members be interested in hearing that?
I think
didn't-
we have
I didn't
previously.
understand the request.
Presentation.
Yeah,
Yes, I've got one.
yeah, what specifically are we looking for in the presentation, Tony?
Well, you know, we just received this monies and we have some CARES monies and we're providing services for our staff. And I would like to know how that interaction of that monies and if we are planning to expand our services to our communities throughout our district. Because I know there's a great need for that, but yet our board members aren't, I feel that we are not totally in tune with this issue.
I'd prefer a board
And
communication
also-
on that, given how crowded our agendas are in the next few weeks.
This is a COVID issue. I mean, this is an ongoing issue. You know, if we plan to have teachers back in the classroom, we need, you know, students, I mean, child care services for them. You think about it, how it's going to affect our staff and how they can come to work or make the decision if they want to be face to face with our students or, you know, stay at home with their students or children. So, you know, let's use our heads, please.
Okay, Mr. Pres, my first question is, you've pulled 3 items out of 11. Did you contact Mr. Hoffman to discuss any of these items previously to tonight?
That's not my concern.
No, that's my question to you.
Show me on the guidelines that I'm supposed to do that.
It's
Yes,
in the-
I did talk to
It's
him
in
on
the
other
handbook,
issues.
Mr.
Yes, I did
Perez.
talk to him on other issues. Nothing.
Yeah, it's in the board handbook, and we
Yes,
have
I
this,
did talk to him.
we have discussed.
Topics though, Mr. Perez, you can bring them up
Yes.
and I'm happy to talk to you about them.
Yes,
Okay,
yes.
then again, Mr. Perez, I have no problem. I just wanted that answered. So the answer is
Thank
no.
you. Thank you, I did. So anyway, on 7, appointment of consulting teachers to teachers induction program. I just want to know the amount of funding that we have and the criteria. You don't have to tell me tonight, but I'd like to know how much money we put into this project and what's the criteria of choosing these particular schools. Are they for low-income students, Title I school support? Because I know for a fact that a lot of students who are serviced by teachers, first-year teachers, their quality of service is not as good as other teachers who have been in the school district 15, 20 years plus. So I'm wondering, what's the criteria? So I don't need an answer today, but that's one of my.
These are the teachers that are
Thank you.
supporting our teachers, are supporting other teachers.
Number eight, I'm concerned, I like to give a shout out to Mr. Robert Pierce and Mr. Matt Sanchez and staff in this department that are doing an excellent job, that are concerned with our quality air within our district. They're doing very progressive ideas and having buses that do not pollute our community. And also, number 2, I am concerned that, you know, we just lost big advocate for our community, Miss Bobby Singh. And I was wondering, was she the one-on-one committee to meet with Elk Grove City? So
Okay, well, we'll get back into committee appointments.
what I would like to see, we haven't talked about those vacancies and the ones that she represents in those subcommittees. So we need to deal with that.
Mr. Press, Mr. Press.
I am volunteering.
Excuse me, Mr. Perez.
Yes, hey, I'm talking.
Excuse me, you asked a question I will answer that will hopefully shorten your comments.
Excuse me, I don't need the answer today. I'm just expressing this. So there's no issue about questions I'm asking, I could wait, but I just want to bring that to your attention.
It's been brought to my attention and it is on the plan. Once we have another member, we will be looking at committees again. I agree with you. An excellent job by our staff on number 8. And I will ask to have, you can speak to Mr. Hoffman about number 6 and number 7. They will happily send out the requirements and the outlines to you in a board communication. May I have a motion to pass number 6, 7, and 8?
Yeah, may I make a comment first, please? Tony, you have already volunteered to be on a subcommittee to look at the applications that are submitted for the board vacancy. And you, Nancy, and I will be meeting on the 19th of January. It's already done. We agreed to that, I believe, at the previous board meeting.
Mr.
So
Fortuna,
it's done.
Mr. Fortuna, I believe he's talking about other committees that might have holes now that Ms. Singh Allen's left, which is a very valid point. And Mr. Hoffman and I have already spoken about it and have a plan, Mr. Perez. We got you covered.
I make a motion to approve those 3 items.
Thank you. May I have a second?
Second.
I have a first by Mr. Fortuna, a second by Dr. Martina Soler. Mr. Yang,
Aye.
Mr. Perez,
Aye.
Dr. Martina Soler,
Aye.
Ms. Charis Espinoza,
Aye.
Mr. Fortuna,
Aye.
and myself. It's unanimous. Thank you. Our next item is bargaining units. Ms. Pinkerton, is there any comments regarding our bargaining units?
Madam Board President Albiani, there are no comments regarding the bargaining units.
I have a comment.
Yes, Mr. Perez?
A lot of those letters had concerns about our employees. And since this a long time, we need some updates from our representative unions to present how they feel about some of these issues and bring it out into the public through our meetings. We have not, I don't remember the last time they spoke in front of this committee about, anything, updates. So I'm inviting them to come to our next meeting to maybe answer some of the questions that some of these letters have presented, were asked of staff and coming back to school and how they feel about this or that. So I think recently, within the last year or two, I don't know what, well, we need their input. And I'm requesting them attend the next meeting regularly and give some input and how they feel about some of these issues and that our employees that they represent are feeling about this issues that are brought up through these letters from the community. So please invite them and to show up at our next meeting and enlighten us what's going on, through our employees and staff that they represent.
We'll do the Elk Grove Unified School District Department of Safety and Security, Safety Support and Collaboration Equity. Ms. Pinkerton, is there any public comment related to this item? And Mr. Perez, could you mute your mic during the presentation, please?
Thank you.
Madam Board President Albiani, there are no public comments related to this item.
Thank you. Mr. Arosa?
Good evening, President Albiani, board members, Superintendent Hoffman, and Ms. Avalos. We appreciate the opportunity to come tonight and highlight some of the inner workings of the Safety and Security Department. We're going to look at some of our thought processes, some of our practices. We'll hear from some folks that we serve, and kind of close off with, we also look at some data and close off with some of our future priorities. So with that, we can go on to the next slide. The purpose is consistent with board policy and administrative regulations. We are reporting to you, the board, on the last year of operations changes, things that we've done differently, processes we put in place, but also in the past you've had some specific questions related to demographics within the department and some data. So we'll cover that along the way. Next slide. Why? We will talk about the mission of the Department of Safety and Security. The how safety and security service delivery model came to be and is continuously analyzed, and how we determine what areas will need for improvement. Safety and security demographic information. We're going to look at training of campus supervisors, security specialists, and school resource officers. Our community outreach program, our youth services may sound like one and the same, but youth services is specific to our students within the district. Community outreach is, we get a lot of requests to participate in community area meetings, elementary schools. A lot of times they're parent groups, PTAs, those kinds of things. School collaboration, working with the schools and quite a bit with the elementary and secondary division. The results of our safety and security actions and services, and then our improvement priorities. Next. Our mission is very simple. It's to protect life and property and ensure the academic tranquility of all staff and students at Elk Grove Unified School District. It sounds, a one-line mission statement is rare these days, but we've taken it down to that point. We believe that in order to accomplish this, we need to work in collaboration with all the members within the district, take their input, find out what their needs are, and adapt our operations to meet those needs. This last year has been a kind of an example of having to adapt. We've gone from an on-campus model where our primary emphasis was safety and security of people to priority of safety and security of property and equipment in our sites. And also we've had an increase in our involvement in the mental health side of operations. And we'll talk a little bit about those statistics and things that have been coming on with some of the issues our students are facing. Next slide. Over the past 4 years, the Elk Grove Unified School District has built and maintained a program which we believe is addressing all the issues and requirements of a comprehensive school safety plan. And when we say that, we mean it includes everything that has to do with school site safety planning. So the plan itself, training, staffing, and then the actual day-to-day interaction and operations within the district. We also believe that we really saw early on in year one that mental health support was going to be a big part of what we do. I don't think back then we ever thought that anything like this would happen, and the level of mental health support that we would be providing would get to the point that it is today. And fortunately, we did a lot of extensive training and development with our staff up front. And so the transition was fairly easy, but it was a big one for us. And then also we spent a lot of time in training and development of the site safety teams. And this is everything from the development training of the teams themselves, the campus supervisors, yard duty, but also if you go back and remember the training we did for emergency incident, that for the first time that I remember that every person who worked for the district got the very same training. So all of this is designed to dovetail with other programs within the district, mental health support, counseling, PBIS, and restorative justice. And so we do not view ourselves as being on an island and outside of the district. We view it as being integrated into the district and a full partner. So next slide. Our primary tools that we use, for me, the decision-making model, which is one I used as a vice principal, and continue to use to this day. I think it does a good job, and it fits very neatly in with other planning initiatives that the district has. And so it gives us a common language to speak when we're planning and working with other divisions. Data collection evaluation. Internally, we've beefed up our ability to collect data and evaluation, but also we've spent a lot of time working with RED in surveys and customer feedback and those types of things. So we've got a lot of data on what we're doing, how we're doing it, and we'll be using that. Plan will identify the needs and opportunities and plan for change or expansion. since this division was created, I cannot tell you that we had a 6-month run where we were ever stable as far as how we looked at what we were responsible for. We've been constantly changing for the entire time as our programs changed, our responsibilities changed, our emphasis changed, and over the last year or so, the impacts of COVID have really changed. So I do believe that based on our structure, we're nimble enough to adapt to the changes fairly quickly. But I think it's at some point, we always talk about getting back to our normal. I think there's going to be a lot more changes in rapid succession coming at us over the next few months. So we use the data and feedback to analyze the results and change. It gets right down to it. Was it successful? Why? We want to make sure it wasn't an accident, that it was something we thought would happen or make sense that it happens, use that information to grow our programs. If the change was successful, can we make it on a wider spread? And I'll use example I use for that is with our discipline model, we put in place a contact model where decisions would not just be made quickly. They would involve administrators, it may involve a director, it may involve an assistant superintendent of elementary or secondary ed, and a conversation with one of us. And we've taken that model and extended it into our attendance program management. We've extended into our what you will see soon in how we use and operate our cameras. So it was a dialogue process that we found was very successful in leading us to make the right kinds of decisions. And so this is a case where we've expanded the scale of that type of process. So you'll see more on that in the coming weeks. So next slide. Integrated services. We view that we're in full partnership with Ed Services, Business Services, Facilities, Human Resources. We are a service organization and our client is the district. We try to include as much as we can their needs and their wants and put them into a place where we can meet those responsibilities. Our underlying rule here is find a way to say yes. And we stress that across the board. And because a lot of times when we get the call, there's not a lot of time. The people are suffering, people are having issues. Somebody's yelling, apparently yelling at an administrator, whatever it might be. We need to be able to respond quickly without putting a lot of roadblocks in place, and we're trying to, as we can, to eliminate that. The big programs, comprehensive school safety plans. That's going to come to you guys very soon. We're getting the last ones in. We're during the review process. There was no removal of requirements, no lessening of requirements from the state, so we still have to put the programs and the plans through. They'll be coming to you guys for approval very quickly. Emergency procedures guidelines. Those have changed to some extent. We now have an additional requirement for a pandemic emergency response plan that we need to put in. Proactive training, professional development. One of the things we've learned over the last 6 to 8 months, there are other areas of professional development specific to what we do and security needs that we need to address that were just not on the table before. And as an example is once we go back in, student interaction on campus when they're out on breaks is going to have to be monitored very differently. And so there's different things that have come to our attention that we'll be doing. Community outreach. In our annual report, the last section kind of lays out our efforts with the communities, foods for communities, the gifts, turkey giveaways, the meetings with students on campus, all those kinds of things that we meet and interact with our customers. So next slide. So Rich Lozano is going to take over and we're going to talk about demographics and training and data. So Rich.
Thank you, Joe, and good evening to the Board of Trustees and Superintendent Hoffman, as well as the community. we'll jump right into this. This slide, in previous presentation, the question was asked, what does the demographic information look like for the Safety and Security Department? And this is the overall demographics as it stands as of January of 2020. So what we did was we took a snapshot of September of 2016, which is about the time that we really engaged in working with our campus supervisor crew and core of employees. And so that would really give us the best initial snapshot of what that looks like. And then over time, January of 20 would bring us to right before the pandemic, where our staffing was at a level that was more reflected what it would look like with schools or kids are in school. And so next slide. Here's an example of one of our job classifications, lead campus supervisor, and kind of the shift there. I would like to say that it was totally intentional, but I believe that part of this shift in demographics was a little bit more on really trying to train up campus supervisors to take over leadership roles, and we'll talk about that here in a minute. But it is a little bit different and somewhat intentional, but it more, like I said, has to do with how we trained or the succession planning and training of campus supervisors. Next slide. So we'll talk about the training for the major job classifications and job families. So let's talk about campus supervisors first. Lead campus supervisor meetings, they include many things, but we have them monthly with the exception of December and May. And in those meetings, like I said, are monthly. We talk about leadership topics and I put that one only in there just because I want to highlight that. And what we mean by leadership is not just basic leadership skills, but we talk about interpersonal communications and working with our colleagues and what that looks like, and really communicating with site administrators on issues that may have developed. On top of that, we talk about, we gather feedback for training needs, push out information that's coming up related to uniforms and different pieces of our operation throughout the year. Campus supervisor training, we do that a couple of times a year. When we get together, it's usually in the boardroom, and we have the whole team there all at one time. It makes for a good cohesive interaction between not only the trainers but the campus supervisors. And those are just some of the items that we've covered the last couple of years, and we'll continue to do that training. We had some training, and I'll talk about that in a minute. We had some training scheduled for November, and we had a big spike and the health order changed, and so we had to cancel our in-person training. But we'll continue to move down that road, and we're really seeing, at least in the opinions of many, that our campus supervisors are feeling more valued and believe that the training that they're getting is from what they desire in the training, as well as what we believe that we can provide, and so we're going to continue down doing that. Real quickly, on November 12th and 19th, or I'm sorry, November 12th and 16th, we had worked with our health director here in the district, Tommy, and we had set up some training, a 4-hour block where we would bring 2 groups of campus supervisors in on one day and talk about personal protective equipment and their role on campus when kids returned. And then the other day we were splitting up between the 2 groups, and we were planning on doing some de-escalation, effects of COVID and kids returning and what that really looks like, and behavioral intervention training. But like I said, that was canceled. It's still on the books. We're ready to go with it. It's just a matter of getting a date and time put together to have everybody back together. We feel that the in-person training is much more valuable for those types of trainings than electronic or virtual training. Next slide, please. It's security specialist training. A lot of it is a lot of it's the same. We have a little different training that we provide them, and one of them is how to use the dispatch MDT, where our dispatchers give them calls to help out throughout the district. That would be different. We had them really included in through our evaluation process, really talk to them about professional development over the last couple of years. And many of them have taken the BIAS LGBTQ training not on their own, but on with their self-initiated trainings. And so we're real happy with that. Again, those are some of the other trainings that we provided. I want to talk about the implicit bias awareness training. We did that in October of this year. We were finally able to get it set up, and we did that in conjunction with our own SROs and the security specialists, as well as the security supervisors in our department. And it was really really good training, and I was glad that we were able to get everybody together to do it as one group. And that I don't want to forget them, but it included our dispatchers as well. And so that was real positive. We had some outward mindset training set up. In fact, Superintendent Hoffman was going to lead that charge and teach the course on November 13th and December 11th. And yet again, it had to be canceled due to the health mandates. Next slide. Just a little bit about what we're working with our school resource officers in terms of their training. The outward mindset training that was to happen in November and December did include a few of our school resource officers, campus supervisors, as well as security specialists. And so I am excited because now Arbinger Institute does offer an online training. And so we have thanks to our CPL department and superintendent have that in the plans and in the works for the next coming months. And so we'll be sure to get that all of our folks through that training. And then advanced officer training, that's just their standard law update training. I threw that in there because it's not just training that they get that's, connected to the school resource officer program, but it's also those other things that we need help with, interpretation of court orders. Sometimes the law changes related to that. The laws change, annually related to many of the functions. So I threw that in there just to kind of give you a broad idea of what all is involved. And the next slide. Community outreach. We do several different things. And like Joe mentioned earlier, community outreach and youth services are certainly different. The partnerships that we have with community outreach are not only the local police departments that we partner with, but also the fire department. We do things like backpack giveaways, turkey drives to help our families in our district during the holidays. And then of course the Elk Grove Safety Fair. And I know many of you have been out to that on that one Saturday in June. It's a great event. We're able to really work with our partners and really work with the community and pass on some valuable information and regarding bike safety and whatnot. So those are some of our community outreach programs that we do. And like I said, it's not just with specific communities. It's kind of we touch our whole entire community, and so it's a good time to be a part of that. Okay, and then on to the next slide. Youth services, and these are, like Joe mentioned, some lunchtime activities at middle schools and high school campuses where we're dropping by, just saying hi to kids and, talking about bike safety and pedestrian safety and things like that. Anything that comes up, our security officers are out with the kids at lunchtime and on the playground and really interacting and being an extra set of eyes for the site as well. And so that's been very successful. Obviously, we'd like to get to every single school every day, but we have a plan in place to hit every school as soon as we get back. And so I think that'll be good. And then Girls Circle is just a girls leadership program that was originally started in a youth services unit of the Sacramento Sheriff's Office, but they do partner with us at those different schools. But one of our managers, Nancy Soto, started it up at James Rudder Middle School and meets with the girls periodically and really just sits down and has lunch with them, does some, again, life skills building, leadership and whatnot. And then lastly, Boys Circle, something we started putting together before the pandemic, and we've got a couple of people in the department that are interested in doing it. And so we're kind of getting that put together and trying to come up with a curriculum to help do the same thing for our boys in our district. Okay, next slide. So the last time we were in front of you, we had some crime reports and crime data, and we realized that it was based on a calendar year because of report numbers. When we pulled report numbers, they're all generated by year. And so that's how we were collecting the data. So we went back and did it by school year. And I think it just makes it a lot easier to understand and to visualize. So as you can see in this slide, we're up a little bit in the 1920 school year. But I think the key really here is that the property crimes have gone up, and I think that has to do more with not having staff on site for as many hours during the day than we normally would because of the pandemic. But that's where, like Joe was talking about earlier, where we've had to change our strategies on what we're doing and how we're doing it. And so we were able to do some of that. So that just gives you a four-year snapshot of what it looks like. And I'm happy to see that, the person crimes are down. And so, or the crime reports for person crimes. So, okay, next slide. And then in the report that we prepared and gave to you, we have some special category events data, and this is kind of what kind of shows you what we're doing. As you can see on the top purple arrow, our mental health evaluation, where we're going out and checking on kids, has gone way up this year, and that's kind of, I think, to some degree expected. The interesting thing is that the mental health evaluations holds are down, and so I think part of that is that we are getting out there early enough, talking to families, and when staff calls in and says, "Hey, we have a concern," or we get a catapult tip, we're going out there and having the the deputies make contact when we believe that a child may be in danger. And then as you can see, the threat assessment piece has gone down, and sometimes those are interchangeable. But what we've done here is if it's something where there's harm to self or others immediately, that usually goes into a mental health type of evaluation rather than a threat assessment. And threat assessment would be more like somebody threatening, making a threat to do physical harm to somebody on campus or something to that effect. And then down at the bottom, you'll see our student arrest did go up in 1920. That is definitely something we are working on. We went back and looked at it as we do pretty much with everything in a continuous improvement type of mindset, and we found that you know the types of crimes that students were arrested for were repeat offenses, and I'll give you an example of that. We had a student batter another student where there was significant, well, not significant, but more injury than bumps and bruises, and we issued him a citation. The deputies did, connected him back with the family, and about 2 hours later, he was back at the school battering somebody again. And so, you know, unfortunately, we had to arrest him because it appeared that the crime would likely continue. So, next slide. So we did, and I have to apologize. This is the data is about a year old. We did a survey where we sent it out to district administrators, both at all of the elementary, middle school, high school, and alternative ed sites. In addition, we sent it out to district office administrators, as well as some of our internal customers here in the department. And you'll see that there are kind of overall categories, and the component, you know, emergency management, school patrol services, district assistants, school or district administrator assistants, and then safety systems. And safety systems are more like, you know, the alarm response, those kinds of things. And so we were happy with the bulk of the evaluation. We do have some things to work on, which is not a bad thing. I think it's good. That keeps us on our toes, and we'll continue to work with our partners out on the schools to ensure they're getting the best level of service that we can provide them. Next slide. So kind of just a summary of the feedback that we received last fall. This report was put together in December of 19. Most effective service areas that we found from all those groups that I previously mentioned were the service that school resource officers provide, missing person investigations and stranger danger type stakeholder communication investigations, and then special event security coordination. That's anything from you know, football games and basketball games to the dances and the performing arts center events. So the least effective areas, and there were several ways that people could respond, and one was not effective at all, least effective. They also were able to put neither effective nor not effective, or then somewhat effective and effective. And so some of the bottom areas of things that we need to at least address are traffic control and enforcement, some traffic planning recommendations, presentations for administrators, and then alarm monitoring and response. Next slide. So we have a couple of administrators here tonight to talk about the integration of services within with our department. And I'm going to introduce Mr. John Santon, who's the principal at Raymond Case Elementary School. Mr. Santon.
Excellent. Thank you, Rich. Excellent. Thank you, Rich. Good evening, Madam President Albiani, members of the board, Superintendent Hoffman, and Ms. Avalos. It's with extreme pleasure that I, John Santon, principal at Raymond Case, am able to speak about what great contributions our safety and security department has been able to help at our elementary schools. Truly, truly a positive presence on and around our elementary schools. In the lots, around campus, just constantly making a positive presence. And really want to just speak to the youth and community outreach. It's really been incredible. To speak of a couple of officers, one officer a few years ago, Officer Dean, it was his pride to be able to relieve whatever teacher or vice principal or myself that was out in the crosswalk, to take crosswalk duty whenever he was able to, and then be able to have special conversations with parents that needed a little extra hints for driving safely around our children. And one particular day, just pouring down rain, says, Mr. Santon, I don't want you out here in your suit. You go in there and take care of the kids in the yard. And just, it's that proactive mindset of just whatever they can do to be able to help on our campuses, and whether it's in the parking lots in the morning or dismissal. As Officer Nancy Soto was mentioned earlier, she just was incredible providing mentorship for children with our recess mentors out at recess time. Often she'd be holding jump ropes and playing with kids during the multi-purpose room, opening up milks and just having great conversations with kids, and it was real positive. As well as supporting our PBIS Tier 2 system with check-in, check-out with a couple of students that needed a little bit of mentoring. And she did some groups counseling with our 6th grade girls about social media and cyberbullying, and just did some, it was a great asset to our school. And then getting back to also the community outreach officers, our children cannot wait for the officers to show up with the special SUVs and the speakers and the Hummer and out playing basketball and Foursquare with the kids. It's just really, really positive in so many ways. And then unfortunately, sometimes we need extra help with interpreting custody court orders. Unfortunately, as Mr. Lozano mentioned, risk assessments, and it even happens at the elementary school, and they're able to be there and support to our school psychologists and our mental health therapists. Just really, I brag and just so appreciative of all the support. But I just had a few things to share, and I'd like to introduce my colleague, Sherry Sanchez.
All right, thank you. Thank you, John. I'm Sherry Sanchez, the principal of Anna Kirchgater Elementary School, and good evening, President Albiani, members of the board, Superintendent Hoffman, and Ms. Avalos. You know, John has said a lot of what I was going to say as well, and they are truly a great presence at our school, and the kids just flock to them when they come. And you know, they want to know, is there something going on here that they need to be worried about? Is their first response many times. And then when they hear that, no, we're just here to say hi and play basketball with you, they bring out the stickers and just interact nicely with the children. But, you know, our district safety and security supports our schools in so many different ways. They've really been very responsive to our schools at all times. And they regularly interpret court custody documents. Just quickly, I'll say I need some help, and they're there right away, which is great. They help us guide the flow of traffic at some of our big community events. And at the beginning of the school year, when we're trying to train our parents to go a certain way, they really are very helpful with that. This year, you know, things have changed through the year here, but this year they've really helped with the property piece, and they've helped deliver all of our Chromebooks to all of our students throughout the whole school district. And they continue to support our schools by going directly home to home, right to their porch to deliver hotspots. They also check on numerous families. If we say, you know, hey, we haven't heard from this child in a while, they're kind of AWOL here. Can you help and can you drive by and see if they're actually there, do a wellness check on them, or see have they moved to another area? So they're just helpful in so many different ways. But I think that the biggest impact that they've had with us and with our children has been their willingness and desire to actually make meaningful connections with our children and be great role models and be like non-threatening and, you know, be a positive influence, a law enforcement positive influence for our children and a mentor for them. So I would publicly like to thank, in my closing here, the whole department for their continued support. And I really look forward to continued working with them. And I just have to give a shout out to our officer, Sue Truitt. She's always there. Even now, she comes and checks on us. So thank you so much for all that you do.
I think it's my turn. My name is Bree Bahar. I'm the principal at Catherine Albiani Middle School. Thank you, Sherry. And thank you, Madam President Albiani, board members, Superintendent Hoffman, Ms. Avalos, and all district staff for the opportunity to speak with you tonight about the support that the Safety and Security Division provides to all of our schools, but specifically to Albiani Middle School. We're supported with empathy and efficiency. I would say that definitely prior to the pandemic, our region became very familiar with the online incident reporting system. And if a report came in after hours in particular, Safety and Security would immediately communicate with site administration to offer support, specifically if the report indicated harm to self or others. Any of the other reports could be dealt with in a different time frame. As you can imagine now, not having the ability to physically have eyes on students since March, we worry daily about their well-being in a different way than we did before. But with any report, we always want to ensure that students are safe. I've had multiple phone conversations with Mr. Oroso and members of the dispatch team discussing the best course of action for student safety. Someone always picks up. Between Student Support Health Services and Safety and Security, I know that our students are definitely in good hands. Just wanted to share with you that on Friday, November 20th, it was the Friday that we were set to go on Thanksgiving break. After hours, 5 or 6 in the evening, I received a call from a teacher regarding a student that had indicated that he was planning on self-harm. Joe Oroso and Don Ross sprang into action, not hesitating for a moment. I felt supported. The teacher that took the report was grateful, and the family was so thankful for the obvious care and concern for their child. As a site leader, I know that someone's going to pick up my call. My concern will be taken seriously, and I will receive follow-up communication in order to continually support students. Thank you for listening to how we are supported, and I'd like to introduce my colleague, Richard Gutierrez from Valley High School.
Good evening. Hello, everybody. Richard Gutierrez, I agree with all my colleagues. So greetings, Superintendent Hoffman, Board President Ms. Albiani, and all of our esteemed board members and district colleagues. First, I want to welcome Mr. Yang to our Valley region. I look forward to collaborating with you. Additionally, I want to thank our Student Support Services, Secondary Education, Superintendent Hoffman, district leadership, and board for all of your support. Both before and during the pandemic, students have experienced various social emotional issues. These issues can be homelessness, depression, anger, and self-harm, among others. However, thanks to the protocols put in place by Student Support Services, Safety and Security, and Security and Secondary Ed, we have been able to respond, collaborate, communicate in a more timely fashion than a couple of years ago. Having said that, I want to share a positive experience that I had while following these protocols. During a weekend in the fall, I received a communication from one of our students expressing desire to self-harm. Following the protocols in place with the last 2 years, I immediately called 911. After calling 911, I contacted the EGUSD Safety and Security and my director. Because of our collaboration and communication, EGUSD Safety and Security was able to respond in a timely manner to where the students received the necessary intervention. In fact, our Safety and Security team actually arrived before law enforcement, helping the student and family at that time. This is just one example of many where, because of the protocols in place, we have been fortunate to support and intervene for our wellness of our students. In contrast, during my first 2 years as a principal at Valley High School, we did not have as a clear system in place where we could communicate and collaborate with departments like Safety and Security, allowing us to respond as promptly as we do now. As a principal of a school with a high number of students who can face significant challenges, I am grateful for the support. Thank you. And now I would like to turn the presentation back to Rich Lozano.
Thank you, Mr. Gutierrez. I think it's Joe's turn. Yep. Next slide, please.
So using data for continuous improvement, when Rich talked about the survey results and the areas that were outlined for improvement, we agree. A lot of those that already come to our attention, traffic control, a lot of these things had come up and needed to be addressed, and they were confirmed in the report. So all of those are things that we think need to be, and that's one of the ways we're using data to continuously improve our quality. What's a little bit different, I think now is just there's not a lot of need for those, but we're still pushing through and making our plans for how we will address those. So when school does return, we will have an improved traffic program. A lot of the things like some of the behind the scenes things where we work with facilities and maintenance and operations that came up, we do them already. I just don't think they were that well known, but we'll continue to work for that. So how data informs our next step. We need to continuously improve the quality of what we deliver. Am I happy with where we're at? Yes. Am I willing to stop pushing to get better? No. And I think that's the general attitude of everyone here. We are public servants. Our public is the district. And get back to it, we will find a way to say yes. We'll worry about the details and how things get paid for later. But it's getting somebody to help as soon as we can, which leads to efficiency. Engagement. My personal engagement with the leaders of elementary ed and secondary ed has never been more so than it's been in the last 1.5 to 2 years. I think interaction with administrators. We've hired new administrators over the last few months, and when you kind of knock on their door and say, hey, we're just here to meet you, and they seem kind of surprised. And so we're constantly wanting to find every way we can to increase and improve that engagement at the staff level, at the parent level, and certainly as the student level. Our agility, the thing we found out, I think we knew it, and we're doing it, but nothing like we've seen in the pandemic era, what we would be required to do and how we'd be required to do it. And the entire team in this district, within this division, has been working since day one. We haven't shut down, we haven't slowed down. We're doing things that we never thought we would be doing, and happily so. We're happy to be helping with the Chromebooks. We're happy to be helping with the hotspots delivery. I'm not so happy that we have the threat assessments and the mental health issues, but I'm glad we have the resources to be there. And I can tell you in the last 5 months, we arrived at the child's home with minutes to spare on at least 5 different occasions. And so, it kind of makes you wonder, had somebody waited 5 minutes to make that phone call, the results would have been different. So we want to make sure that we're agile. We have the ability to adapt, that the managers and the supervisors know what their decision-making responsibilities and authority is, and that we move on these things as quickly as we can, and that we're constantly circling back with the principals and the site administrators. I said it earlier, I think the biggest component of improvement that we've seen is the ability to dialogue with all levels within the structure, and to put together plans of action to understand what we're being asked to do and move through it. So next slide. Oh, okay, I'm sorry. Are there any questions?
Thank you very much. I'm sure we have a few. First of all, I wanted to comment. Ms. Charis Espinoza has asked me to announce she had to reposition due to health reasons and shut off her camera to avoid being a distraction, and she will be back for her question part. So we
Ms.
will.
Albiani, can I make one request? That if we had questions for our principals, that we would do those questions right at the beginning and then allow them to maybe get some sleep because they're going to be taking care of our kids very soon. Not that Joe and the rest of us won't be, but I would like to be able to get the principals off the back to their home life if at all possible.
Sleep's
Okay.
overrated.
Sleep's overrated. Yes, we will go through with a principal only question if you have one. If you do not, it is not an issue. Mr. Forcino.
No.
Thank you. Dr. Martinez-Alier.
No, thank you for being here.
Mr. Perez.
Yes, I have questions. Have you seen, any principal could answer this, have you seen the data results? For instance, let's use the mental health, 154 visits or on-site cases or reports. Have you seen a district-wide report of our district? Or maybe, what have you seen of the data?
Hello, Mr. Perez. How you doing? This is Richard. The data that I have seen, it is the LCAPS survey that we sent to our students and parents back in November, December. That data was shared by Red, and then I don't have it memorized, but certainly, you know, I personally have seen the data comparing my school with other schools, and also looking at the data from, you know, just within the district, just to see how the kids are responding to the mental health. The data was engaged around rather 3 points is engagement, and then also their mental health state, and that's kind of the data that we currently most I personally have seen.
Any other principal? Anna Kirchgater, have you seen any data reports district-wide or your particular school?
Yes, thank you. Yes, I have. Same thing that Mr. Gutierrez has seen, that we've all seen. We've shared with our community, with our school site council, and with our teachers. And we also have teacher surveys in that included with the parents and the students.
Okay. As a result of that, we're talking about school climate, correct? You brought up the issue regarding LCAP or the LCFF. So that's one of the issues within school climate, correct?
Yes.
Okay. So I'm wondering, as a result of looking at this and maybe comparing your school site to other school sites, is there a way to prioritize funding and services for our district? Because I know for a fact that in high poverty areas, they need more services, and there is a lack of services in region one, my area, Florin High School and Valley High School, all the way to, you know, elementary, middle school, and high school. So have you seen that improve?
I just want to say I have seen it improve, and I have seen the district's response being proactive in that. We currently have a mental health therapist now 3 days a week instead of 2 days a week prior. So that's been a reaction to some of the LCAP data and some of our requests as well. So I feel very satisfied and very supported by the district in this area.
Is there a need for more funding and services?
Well, there's always a great need. I think, and I believe this week we're going to have a meeting with Student Support Services to talk about hiring of psychologists, I believe, to help with the mental health therapists. Me being a big advocate for the wellness of our kids, you know, that is always an area that we wanted to focus here at Valley. That's why we opened a wellness center here at Valley, so that my wellness counselor, you know, can support more of the mental health of our kids. And I think that, you know, through this time, as I stated in my statement earlier, in the mental health of our kids right now, it's very particular to, you know, adjusting to this pandemic. So we can hire 100 mental health therapists, and I don't think it will be enough. But certainly, having the resources and the support that our district has provided us, has given us, including the board, has been, fundamental, has been very key. So thank you for that.
Any other principal?
Mr. Perez, I would just want to echo what Ms. Sanchez said, and being able to use that LCAP survey data and be able to take it back to school site council, our own site leaderships, and then be able to tweak. And we're very pleased with the results. And one of those things that if we have great results, and if we have the saying that if it's not broke, don't fix it. Just keep doing the great things that we're doing and reaching out to families.
Yeah. Well, I guess maybe within the last couple of board meetings, we were told that we had a project with mental health workers working at different school sites. Now, is there, as of today, is there mental health workers?
Mr. Perez, I think this is an excellent subject, but our agenda is on safety and security.
Yes, if we have students that have a mental issue, that could affect security. So this is related to health and safety of our student body. So I think it's pertinent to have that answered. Now, do we have mental health workers at your sites assigned as of today?
Yes, we do.
Yes, we do.
We do.
Is it efficient?
Yes.
Yes, absolutely. They're very efficient, very proactive.
Okay, Mr. Lozano, you are in charge of data. What are the priorities?
Mr. we want to just do the principals. I'll come back around and you can ask questions to the staff.
Here's another question. This is for all the principals. What can we do for you? Is my understanding that our Governor Newsom has $2.4 billion. What can we do for you if we get some funding in this arena, or, to help you serve our students?
As Mr. Gutierrez said, if we were to hire 100 mental health therapists through the support, it would be scratching the surface.
Bang. Woo. Any other principal?
I would echo what my colleagues have said. Regardless of the school and where it's located in the district, the more mental health professionals.
Okay, here's another question, principals. I support school health clinics. And if you know that the educational outcomes of students, if you have a health clinic on site, how that affects the learning of students? Any of you knowledgeable in that arena?
No.
No? Okay, well, that's what I've been pushing for. As you know, I know that the ADA goes up, more helps attendance when you have students that are healthy mentally and physically. And so, do you think, oh, okay, Mr. Gutierrez, you have a health component academy there, correct?
That is correct, Mr. Perez.
And do they participate or study these issues as future health professionals?
Oh, absolutely. We have our health tech program. They focus in two different areas right now. They're looking at the how to support our families culturally based on of the pandemic, and also the mental health. We do have a grant from I believe Kaiser in the county that they specifically to the mental health of the of our students. So we have a group of kids that work with a wellness counselor that do a lot of mindfulness and via virtual learning right now. So we do have our health tech very proactive to doing different things.
I know some of the schools have parent involvement dealing with school security, school outside, what do you call it, the signs? Do we need to more support that a little bit more at the elementary level? Like what do they call dogs or stray dogs or big dogs?
Oh, Mr. Perez, watchdogs, but due to distance learning and not having anybody on campus, some of our programs that we've had for involvement have been had to be put aside until we're able to be back in person.
Right, but I mean, do you continuously train those individuals to keep them update on certain issues? I was wondering. You know, they're a good resource and they should be involved, you know?
Yes, sir.
Okay. Oh, that's the last question I have for you. Keep up the good job.
Thank you. Ms. Charis Espinoza?
Thank you, Madam Chair. My only question for the principals, and this is for all of them, anyone who wants to chime in, how has the job of maintaining safety and security been different this year with the kids at home? Can you give me some examples of some things that you had to do now that you wouldn't have had to do last year?
I can speak.
Oh, go ahead.
I can speak to that. Like I mentioned when I was speaking, if normally we would be able to put eyes on students, right? We're seeing them walk up and down the breezeways. We see them in their classrooms. So obviously it's a little bit harder to ascertain their well-being through a little square on the screen. But we've been supported in going out to and doing porch visits to our students. Obviously that's a different situation, different from a home visit, but just checking in, making sure students who don't have access to come to school, for example, for textbook distribution, to pick up a Chromebook, to get a hotspot, those kinds of things. So that's been a big difference. Students are still using the online Catapult report system. And so we're still able to communicate in that way and to get information and make sure that they have the supports that they need in a variety of areas.
Thank you. Anyone else?
Yeah, that is here for us too. Our the porch visits has been very essential ever since we started to do. It depends on of course the color that we are right now. We're not doing any because we're in purple, but we'll never be able to do porch visits. That's something that our team does.
Thank you. That's all I have for the principals, Madam Chair.
Thank you. Mr. Yang?
Yeah, thank you for the presentation. I want to talk about the graphs of the employees that show different demographics on the presentation. Just outside looking in, my question would be, this is a very diverse school district, and looking at that graph, it looks like the demographic doesn't reflect on our student diversity. Is that what it is? And if it's so, is that a concern to you guys? And if it is, will you guys be looking into make some adjustment in terms of the hiring metric?
Mr. Yang, this is a question for the high schools or for Joe or Lozano?
I think it might be more of a staff issue. Mr. Yang, once the principals go, we can follow up with.
Well, I could ask the principal. Well, let's see what they think of the graph. I mean, yeah, I mean, it's a question to them. What did they think?
Well,
is that a concern to you guys as well?
Well, in regards to here the Valley, we try to be proactive and work with our student, our security, and safety to hire the best qualified, for our sites. So whenever we have an opportunity to do hire, individuals that represent our demographics, we absolutely, take that opportunity. Sometimes, unfortunately, the pool does not reflect our demographics. So we kind of only hire within, those, whatever is available in the pool.
Anyone else?
I believe these are only high school positions, so for the elementaries, it wouldn't, or middle school, it wouldn't be appropriate.
All right. Did you have anything else, Mr. Yang?
No, that's it.
Okay, thank you. I'd like to move to get a motion to have our meeting go past 10 o'clock tonight.
I move that the meeting go till midnight.
I don't even want to agree to that.
Okay, then my motion is that,
I'll second that.
no, I think we're gonna be there anyway.
I'll second that.
I move that we extend the meeting 10:45.
Thank you.
That sounds better.
A second?
Second.
Second by Mr. Perez. Roll call vote. Mr. Yang?
Yes.
Ms. Charis Espinoza?
Yes.
Mr. Perez?
Yes.
Dr. Martinez Alier?
Yes.
Mr. Forshina?
Yes.
And myself. Thank you. I have no questions for the principals. I greatly appreciate you being here tonight, and I appreciate what you do, and I have such high respect for how you take care of our students and our teachers. So take care of each other. Thank you very much.
Thank you.
Thank you very much.
Thank you.
Be well.
I would
Thank
like,
you.
Mr. Yang, did you have a question for the administrators, for Mr. Rosso or Mr. Lozano?
Yeah, my question would be the same question that I asked the principal.
Okay.
Excuse me. Can we take down the slide? that's
Yes, I
currently on
understand.
screen so that
Can we
can
please
have?
remove the screen so we can have the full people, please, whoever's. Thank you. Mr. Rosso, would you like to speak to the diversity of your staff?
Yeah. I think it's been said, with respect to the different staffs. I think that we've made a huge improvement over where we were. Many of I think one of the slides you're looking at was campus supervisors. A lot of those campus supervisors have been employed for years. The change we saw is who is moving into the leadership positions. Normally when a campus supervisor position is filled, we advertise it. And even during the pandemic, we are almost advertising for campus supervisors constantly. We are interviewing constantly. So it's an entry-level position. Not everyone's interested in it. When we were still doing job fairs, we were actively out interacting with the folks that were visiting the job fairs. We've had our folks out at community events throughout the community in every aspect and every area within our region. So we are actively doing everything we can to improve our hiring. In a lot of the positions we've included community members on the panels. We've worked very diligently to make sure that the right people are getting into the right positions. At the end of the day, the candidate pool is the candidate pool. So I hope that answers your question.
And if I could jump in here, Mr. Yang, and I forgot to mention that welcome to the Board of Trustees and congratulations on your election. I think the reason I threw that lead campus supervisor graph up is because I think it's important that exactly what Joe said is correct. But what we have been able to do in the last couple of years is, and we've had some campus supervisors that have been with us for a long time, and they stay in the campus supervisor position. We've been out actively recruiting our own people
I think one of the things we've done to improve is we've tried to look at the campus supervisor position as a career, professional development, training. Most of our school security specialists have been filled from the campus supervisor ranks. So now there is training and development and a place and a purpose and a place to move. So we're hoping all of those things together will begin to draw a broader pool of candidates, and that's certainly our goal. But we spent a lot of work. We've done a lot of work in the last 2 years to convert the campus supervisor from somebody who's just standing by the fence with a radio to an actual involved member of the site with job satisfaction and some upward mobility that will allow them to interact. So.
Yeah, thank you, Joe. Thank you, Rich. Yeah, the reason why I brought this question because as a representative of the community, especially the constituents, they are in concern of representation that, you know, has diversity in there. And I'm glad to hear from you two that you guys are working toward to, you know, to cover that diversity. So thank you for your work. Appreciate it.
Thank you. Ms. Charis Espinoza.
Madam Chair, a few questions / comments. First, I really appreciate the breadth of the trainings that the staff has been undergoing, and you know, having gone through some of those myself, I know that they really require you to put yourself in an uncomfortable place if you're doing them correctly, and if you're going to get anything out of them. So I appreciate you guys taking that on, and at least starting that process. I would like to see, in addition to those, something related to cultural competency, just because, you know, we all need to be able to get out of our box a little bit more. And, you know, you've had some entree into that with the open mindset training, but I think cultural competency is also helpful in that vein. So I'd love to see that in the future. The outreach, there's certainly a lot that's going on, the direct outreach to schools. It seemed, and I'm not sure if I'm wrong here, but it seemed that it was skewed a little bit heavier on the primary side versus the secondary side. And I would like to see a little bit more in secondary and in high school in particular. And I mentioned this last time this issue came up, the last time you guys reported. I'd love to see direct outreach to our student equity councils, to our Black Student Union, to our Latino student associations, because I think that's where you know, a lot of our problems lie, and we need to foster understanding in both directions there. I also have some thoughts on the survey. So first off, let me say, the things that you guys, that the department is doing well, you're doing exceptionally well. You know, I can see in my mind's eye my namesake officer playing on the playground with the kids, and it is heartwarming. And the examples that you share of the you know, officers arriving just in the nick of time, you know, when a student threatens self-harm, it's chilling. And I honestly can't even fully take that in and still remain focused on this meeting, because it is just such a huge thing that you're able to do that.
So I don't want to come off as seeming, that we're asking you to be all things to all people. But in a certain sense, I think we are, by recognizing that you're doing excellent work in some areas and that there's still, room for growth and improvement in others. When the board, has hundreds of people come and say, I think there's some shortcomings or some deficits with respect to safety and security, and those things are not captured in your survey instrument, I think there's a problem with your survey instrument, right? You identified as your customers administrators, and that makes sense because those are the people who call on you directly. But I would urge you to broaden your definition of who your customers are, because if it's not capturing the areas that so many members of our community come and share concerns about, with us, then you definitely need to cast a wider net. So that's what I would like to see going forward, but, keep up the great work, and I appreciate the direction in which it's going. Thank you.
If I could just speak to the elementary aspect.
Yeah.
A couple things. As some of you may remember, years ago, elementary didn't get a lot of service at all. Everything was focused towards the secondary sites, and it was really even focused towards the high schools. One of the things we've done is in our training with our campus supervisors is to bring them into that mindset also. So a lot of those things are being done through our campus supervisors and our SROs at the secondary side. What we're trying to do is build the relationships with the elementary. So I don't think you'd think we're ignoring the secondary, but we're trying to bring some balance, but also include everyone.
Yeah, I appreciate that context. That makes a lot of sense.
What's that?
I said, I appreciate the context. That makes a lot of sense, that you're working on an expansion really into the primary. So that hence the focus there. That makes sense.
Yeah. And the other thing I would say is I don't necessarily want to wait for a survey to find out we need to improve in some area. If people have concerns, we just as soon get on it right now. If we need to fix something and move it and not wait till we get a survey. So I would just encourage you to please share with us any concerns your constituents have, and I guarantee you we will address them immediately.
Thank you. That's all for me, Madam Chair.
Thank you. Mr. Perez? Who will be followed by Dr. Martina Salir.
All right, pull the page 20. It says, what improvements, priorities do we have?
On page 20?
Yes, you mentioned you were trying to do some priority. What areas need more help and services, engagement, where? How do you develop a high priority improvement monitoring system? What are the present initiatives you're working on?
So present initiatives are some of the training aspects that Rich Lozano talked about. We think it's important that those get right back on the table the first instance we can. We need to continue to develop our site security models. One of the issues right now is implementing the camera system and how that will work and how it's integrated. The schools that it is already, we've seen a huge impact in crime reduction in those areas. A lot of the things that Nancy spoke to are on the agenda. The things came out in the survey are all in our plan. As far as traffic control, we're going to come forward with some solutions within the next 3 or 4 weeks, and we'll bring to Superintendent Hoffman about how we're going to work with those traffic control. All of those things are all priorities in a system where we're back in. What we're struggling with now, and a lot of the planning that we're doing as far as priorities, is how we are going to help with the integration of students as they return to campus. And I'll give you, as an example, we at a exec staff meeting, Mr. Hoffman and Mr. Pierce talked about some of the things they saw when they visited other schools, interaction with students and how they were interacting once they got outside the classroom. And it really made us come back. And I sat down with Rich and said, you know, we're really going to have to be in a place where we understand the personal protective environment that's going to be expected. So with the pandemic, our priorities have changed dramatically, sometimes daily. Our priorities changed today with the announcement of the move to red, which means we have to start gearing up. But my question is, gearing up for what? And so we will be spending the next couple of weeks, just like every other division in this district, trying to figure out what that means and how we're going to adapt and be able to service our folks. So I'm not trying to be non-specific about it, but I think a lot of the issues that we're going to have to address, we don't really know about at this point in the short term. In the long term, we're going to continue to address hiring. We're going to continue to address outward mindset. We're going to continue to address equity. We're going to continue to address all the things that we've done, a lot of them with your board input over the last 18 months to continue to improve.
Have you discussed any issues regarding students? How would you be in part of enforcement besides teachers and other staff on campus to wear masks? Well, what's your role in that situation? Because, you know, I'm not very pleased with our sheriff department, not pleased with our police departments, because this is a matter of national security issue, and we need to more stronger, you know, emphasis on wearing masks. It's a matter of life and death situation out there in the streets.
My role when it comes to that will be what you and the superintendent decide it's going to be. And again, that's one of those questions that are going to come up. If there's no law that specifically says we can enforce these things, we just can't go out and enforce them. So I think I think you're asking me a policy question. And again, I'm not trying to avoid giving you an answer, but I think it's going to come down to what you folks decide it's going to be.
Well, see, that's an issue. I'm glad I brought that up. You know, I'm not sure if
masks are part of the plan, Mr. Perez.
Discuss that issue with us. But as for me, I want some clarity in that school that if you're not wearing a mask, you be reprimanded. You know, and also, you know, that's like urban terrorism. You know, to me, if you go to a site, if you're positive and you infect 8 other people, you know, it's community spread, that's an offense.
Mr. Perez, we've spent a lot of time with schools that are open, where masks are part of the process like ours, and kids wearing the mask and kids holding to that has not been the significant issue that people think it is. It is with some kids with special needs where the masks are physically a problem, but we will address those issues, and all staff will be involved in making sure that staff and students are adhering to the protocols. I mean, you're right, you will put another person in danger if you're not following the protocols. We'll use education and we'll use you know, strategies to be able to do that. But if it comes down to somebody just being defiant and not following the procedures we have in place, we will address that.
So Beth, as a chairman, what's your position? Are you going to support a policy, or are we going to decide that we're going to make a policy that everybody wear a mask?
It's in the agreement already, Mr. Perez.
It's in the agreement, and it's in the directions, Mr. President, it's in the directions from the state. It's in our directions from the state on safe reopening. So of course we will be wearing masks. And I actually asked the principal when I toured the school set up for COVID, for the return of students, when we toured what they had set up. I asked her what she felt would be the issue with, if she felt masks would be an issue. And she quickly answered me, she did not feel it would be an issue. She felt it was something akin to a dress code that required education. And she felt that she didn't see it as an issue, Mr. Perez. I don't see it being an issue either. There's always an outlier, and we'll deal with them.
We'll address it if we need to.
Yeah.
After the fact.
Well, as it
Total-
happens, Mr. Perez, we can't like address it before it happens.
Can we take a pro-action policy to for this issue?
It's already, we already have the
Yes.
agreement. It's already in place. So we
Yes.
have mask signs at all of our schools. That work's all done.
Yes.
And what's gonna, so what happens if a student doesn't wear a mask?
We will educate the kid first. We'll work with the family next. And if it becomes a defiance issue, then we'll work through the discipline process. We deal with these kinds of things all the time, Mr. President. We can handle
Does our
that.
community understand that?
I think the whole state does.
We will be crystal
I'm
clear.
asking you,
as
does
we
our
have kids-
community know that?
We have kids back already that are doing the day camps, and that's in place and it's working. So we'll be okay.
Well, when you open our day camps, my understanding, there was an incident, a cases as a result of not wearing masks. You know, so.
I'm not aware of that. So if you want to bring that to me, we can have that conversation. But the reality is you can still get infected with the mask and socially distance. They're better policies and practices to have in place, but those aren't guarantees.
Yes, but as I mentioned earlier, we have another strain that's more contagious than we have presently. So when that happens in our community, you know,
If we get more advice on what to do with that strain, we'll follow that as well. And as you know, the vaccine is the other tool I have at our disposal.
another question here. What areas do need more services, Mr. Russell?
In what context?
Anything?
Well, we could always do better and we could always do more. It's a balance of.
But where's the priority? Because you're short staffed and maybe we need more CARES monies or other funding to support these possible initiatives that you might want to implement, but there is no funding.
So I wouldn't classify us as short-staffed. The thing that we constantly have to remind ourselves that every dollar we spend is a dollar taken out of a classroom. It's a dollar taken from another program. And so we have to be cognizant of that. And part of our professional development is getting better at what we do with what we have. If I come to you or I come to the superintendent and I ask for a resource, I believe that I have to have a very, very, very good case for taking that money out of a classroom. And I'm cognizant of that because I spent a lot of time in a classroom before I came to this side. We don't look for problems to throw money at. We try and look at the problem, figure out if there's an in-house solution for fixing it, getting there. In a majority of the cases so far that we've seen, through internal staff development and changing some of the ways we do things, we've been able to address it. All of the outreach, all the community outreach we've done, we are a 24/7 operation. And as you heard, we answer the phone all the time. We're not always getting paid for that, but we do it. And so we just have to find different ways to do things first. If we can't, and it's a priority, and I in good conscience could go to the superintendent and say, please give me this resource. I want to be able to justify that it is indeed a good reason to take money out of a classroom.
Right. I'm glad you brought that up because that is a big concern throughout California school districts when you have police services, because it's not only taking money out of the classroom, it's taking money out of the counseling department and mental health services for our experts at this situation. And as you were aware, most of your visits are 154 for mental health. I was wondering, would you be receptive whenever you do a mental health reaction? If you get that information beforehand, can you partner with a mental health worker with you as a team effort to resolve that issue versus a police officer?
So imagine yourself going into an area
Yeah.
In the middle of the night, 2 o'clock in the morning, in some of the areas that are into a family dynamic situation.
Exactly.
You know nothing about.
Right.
You're not going to want to take somebody there who is not up to speed on what might happen. I'm telling you.
Yeah, I know what you're talking about.
What I'm saying is I've seen some things in some family houses.
Right.
And some of the things that our children have to live with.
Right.
And we are going in, we're not going in to solve the mental issue. We're going in to stop something bad from happening.
Right.
Once we've stopped that and we make sure that we have control of the situation and that child's not going to harm themselves, then that's where our system of support kicks in.
Yeah.
All those threat assessments that you saw that resulted in a student being taken into custody and put into a mental health hold, every other one almost that we saw resulted in a referral back to the site administrator and a contact with our mental health and student support and health services folks following up. So we have a very good system, but there's a reason that only a law enforcement officer can place somebody on a 5150 hold. And it's because of the circumstances that are urgent, that need to be rectified and stopped.
Right, but you know, I have seen and I have witnessed and I have seen national TV, Black Lives Matters and all these issues that, you know, when, you know, people just call and it's been escalated and somebody was killed because of the fact that it was a mental health situation versus a police, you know, and I understand where you're coming from too, because you're there and when they see the bads, it kind of de-escalates it. But yet at the same time, it could very well escalate it to something greater. And people might not even want to even call because, especially people, community of colors, they don't want to call the police because they know what's going on throughout the United States. That when they call the police, it just happens that boom, before you know it, a family member has been killed.
And that, Mr. President, that's why we want our people whenever possible.
So, and I know you're developing the trust within our community, and I'm glad you're doing it at the elementary level. And that's very important that you're doing that, developing trust in their community of colors, that they could trust you. And I want to say too, we had, okay, there's an issue of that. There's model programs that I have seen and that are being developed and doing partnerships with, you know, county mental health people, going out with, you know, an officer, and then they know the community, you know, even Kaiser people, mental health, they take ride-alongs, and that's part of training, you know, and I think you're doing a good job, but yet I think you need to develop partnerships with, you know, county mental health, Kaiser mental health, who are servicing these people, and they have track records working with these people, and they know what type of medication they're on, and this and that. And so, and we need a little bit better database also, you know, on this situation. As far as I'm concerned.
Duly noted, sir.
Understood, Mr. Press.
What?
Understood.
We got you.
Yeah. And you know, you're getting there. Okay, that's one of the ones. Now, you work with SARB assistants. Now, after working with them, how much monies are you creating or improving attendance of our students with your participation? Because last time, you know, again, there was a presentation when the police service they did a lot of work with, you know, SARB, SAARB, and they did a presentation, and they had data in which when they went to a family stating, hey, you need to get your student in the classroom, and they had data, and they was given to us before Mr. Hoffman was here, and they gave us data of how much money they generated for the school district as a result of their services.
I can't speak to that, Mr. Perez, but we remember
community.
Mr.
Now,
Perez.
did you do that?
Mr. Perez, we reset up the office of attendance. But
Right.
that's now so that work is being done. So that's not part of Joe helps with that a bit, but he's not going to be able to speak to that and say we can do a different presentation or a BC related to the office of attendance to get you that information.
So, I mean, would that be helpful? So what role do you play in that arena?
When a case is escalated into what we consider tier 3, so all of the other components of the attendance improvement program have been exhausted. Parent contacts, outreach, letters. Once all of that has been done, then legally we can send one of our SROs out to contact the family to try and ascertain what has happened, why the student's not making attendance.
Right.
But all of those efforts have to be exhausted prior to that.
Well, that's an issue with me then. If you only go when it's a 3, when the other police officer were going at the early intervention at the stage level, they had lists of high
That's incorrect, sir.
students, and they nipped the bud. They didn't wait till tier 2 or
not-
3. They went
We
early.
have other people doing that work now, Mr. Perez.
Yeah, but with a badge, when you knock on somebody's door with a badge, that means these people are serious. They, after all, then
It
you're
didn't
gonna
work.
wait
It didn't
20,
work,
30
Mr.
days
Perez.
of absences?
It didn't work. And whatever,
Oh my God, it worked.
and you asked Mr. Forcina. Because we made the whole change because we did a deep dive into attendance.
It worked.
And we came up with a better process.
I don't think
I
you
don't know what
did.
they shared with you, but
Yeah.
I'm telling you,
Hold
the
on,
new
hold on.
process.
So let me ask you this. By the time you get involved, how many absences will they be?
I can't answer that. I don't think there's an average.
Right.
But
So how much dollars,
Mr. Perez,
dollars do we lose as a result of not dealing with an issue?
We deal with it more than we've ever dealt with it.
Yes.
But we don't do it with officers knocking on doors in early interventions. We talk
Well,
to
you know what,
families and
those
work through
officers-
processes to get them back in school.
Let me tell you, those
And-
officers were from the community.
Yeah.
Those officers knew the community.
I'd like to jump in quickly on that and maybe we
Yes,
put it to
Carmine.
bed. In the last budget cycle, we approved the addition of personnel in the attendance office on the basis
Yeah.
that they were generating funds through lost attendance that was paying for their positions.
Mhm.
The data's there. It's been shared with us.
Okay, I know that.
We-
Okay, let's go back to Joseph over here. Give me a data set of how many students do you see as a result of when they're at tier 3, and how many days have they lost?
I guess
Mr. Perez, Mr. Perez.
Yes.
Okay, you're getting quite confrontational.
No, I'm very serious.
You are coming across as quite confrontational. I'm sharing that with you.
Excuse me.
If you would like to know more about the attendance office, we are happy to get you that information. Mr. Rosso is in a system where he comes in when he is asked to come in. It is not his job to create a data system of that.
Well,
So
if
if you would like to, a refresher of the, excuse me, if you would like a refresher of the system we use and when he is employed, and if it is not clear to you how that happens, I will happily have someone meet with you from that office and they can tell you how it's going.
No. I think we all should see this data.
I already feel I know, I have received the data before and I feel I know what's in it, Mr. Perez. I feel confident with the data and the process. You do not, obviously, so we would be happy to educate you on that. And I will do that in a future date. Can you please get to questions about the report? We are now at 10:31 and we have 5 more items on our agenda.
Yeah, like I said, I like to see the data. I like to see it.
We would be happy to share that with
Duly
you. It will not
noted.
be tonight.
Yeah, how many students, as a result of reacting at the tier 3 level, how many dollars have we lost?
Impossible to do.
No. If that's okay, I don't think so. Mental health, let's get. Okay, let's go to page 17.
Ask the question, Mr. Perez.
You're on 17, let's see about page 17. I don't see it on the,
Just ask the question.
Mr. Press, we've all seen it. We've all read this. We've all had a chance to speak to him about questions prior. Would you please finish up, sir?
well, I want people to see what I'm talking about and for you to see what I'm talking about.
Let's go then. Please ask the question.
I'm sorry, I'm so getting loud. Okay. Like, here's some recommendations. You need some footnotes for these columns, what they mean.
There's an entire report.
Yeah, there's some footnotes, emergency management, school patrol services.
Mr. Press, did you read the thick report that came this? This is just the presentation.
Yes, I did. But on this form right here, we need some footnotes. You know, I like to see some footnotes. And then also, I would recommend not only you have the percentage, you have a forward slash the number that 19 represents. You know, how 19 represents how many? 54 represents how many? So you have the numbers and the percentages. You know, to me, yeah, you have 54, but what does that represent in cases and numbers? So that's how they do it in the, go to the research unit. They know what I'm talking about.
Yes, sir. We will get it done and get it to you.
Yeah, so do you agree? So there's percentages, but yet there's no numbers.
We will modify it and get it to you.
Okay, that's a suggestion. So because, you know, I can see that you're somewhat effective or effective, but what are those numbers? Well, what they represent number wise. And I think the other screen or table had that too. They had the numbers, but they didn't have the percentage.
We understand.
Yes,
So
sir.
we move on to the next one. We got it. Thank you. How long have we come on.
You got it?
We
Yes,
got
sir.
it. Okay, thank you.
Page 15.
Oh, you're serious?
Yeah, I'm not finished. I got questions for almost every slide.
Can you please try to move them in quickly?
Okay, I'm gonna try to maybe about 2 more because I know you're tired. Crime data. See, again, we do not have numbers. And
We understand that.
okay.
You do have numbers. It's at the top.
But
There's
what?
the number and you take a
Okay.
percentage. You can
Okay,
figure it.
let me ask. Okay, here's the one I really looks kind of funny, distorted. On 2018 and 19, you had 77%, right? You see that? The level? You look to the right, you look to the 70, but it's much higher. So you have to have the numbers kind of
70% of a different number, Mr. Perez.
right.
70% of 313 instead of 77 of
That's why you
266.
need numbers and percentages in there. So because you look at that, what the heck? Okay.
Sir, we'll fix it and have it to you tomorrow.
Okay, that's the example I'm doing. The visual looks distorted and not right. So again, you need things like that.
Understood. We will fix it and get it to you tomorrow.
Thank you. No, there's no hurry. You mentioned we have Nancy Soto. Now, she works for a CBO or for our district?
She works for the district.
Okay. And what unit?
She's part of my division. She's a supervising manager in my division.
Okay. No special funding, straight funding for our school district?
Say that again?
General fund.
General fund, yes.
Okay, good. Now, you mentioned on slide 12, you had advanced officer training and the new laws and legislation. Now, do school district personnel also get that from you?
Yes, they do.
Very
It
good.
used to be annually, but the way things are changing, it's getting to be every 45 days or so.
Exactly. Legislation's changing so much that you almost need a full-time person doing that.
We are cognizant of that, and we are really fortunate with our representative from Lozano Smith. Also, our partnership with the El Grove PD and Sheriff's Department in having resources to make sure our folks stay current.
Yes, so put that in the budget. I will support that.
We've got it covered. There's no need to expense it.
Okay. Okay, threat assessment's very serious issue within our communities. And now what we see on TV, you know, I'm not sure how that spills over within our student body. Is there any correlationship to that? Hate crimes.
None that we've
Hate
seen.
crimes.
Our threat assessment issues tend to run in personal threats.
Right.
Some student getting upset about something happened in school and making a threat against the school or somebody else. And we're not seeing any of the national issue kind of thing spilling over in our environment as far as threat assessments go.
Yeah, well, with these individuals, I think in this arena, personal threats or disrespecting somebody or bullying somebody, I personally think that is underreported, and we need to do that a little bit better, or get people to respond better, because, yeah.
Our catapult system, I think, has been very successful.
Very good.
And we're going to start tracking that data, and next year's report, you will see catapult data.
Right.
So to address what you just spoke about, I think we put in place a system that is making us better in that respect.
Okay, very good. Then now we need a pipeline. We know cadet training courses, things like that. How many of these individuals go into these positions as a training? Is that possible?
Into like a campus supervisor?
Yes.
It's absolutely possible.
And has it been done, or has there been a pipeline, or individuals gone that route, then possibly got into police cadet program? Is that?
Oh, absolutely. As far as police cadet programs, absolutely. Pipeline into our system, there's been a couple, but yes.
So that's what I wanted you to include in your report, that we kind of have a pipeline in place doing that, but I want you to get credit for that.
Duly noted, we will add it.
Okay, there you go. I'm glad. And then partnership with maybe the junior college consumers, junior college police program, or whatever, you know, maybe we have those individuals who are going into police science, maybe at the junior college level. Oh, well, Dr. Martinez might know that, and because he's a counselor there. And so we need to develop a partnership with the police academies within the universities, state colleges, and junior colleges.
Sir, that's a bit out of my lane, but we will certainly help CTC in any way we can to make that happen.
Yeah, get our personnel people to go out there. I've seen them out there in the community. They're doing a good job of doing recruitment. All right, for the sake of time, I did have some more questions, but here's the last one. You know that I've gone down to try to talk to you people, try to get some GIS mapping software to determine where to do analysis and response through ArcView 10.45, whatever it is now, to do analytical studies where our priorities are, and partnership. I know that, you know, the Office of Emergency Services do use that very much, but I was wondering, again, do we have that capability to do that within our school district? Mapping software, geographic information systems, and how to respond. Yeah.
I'm not sure what we would map.
Yeah. Response time.
we know what those are. We could track those. We don't need mapping to do that. We could track those internally. What goes on in the communities is not necessarily in our brief. What happens on our sites and affects our sites is something that we do track. And response times have been an issue. A response time was an issue with Mr. Hoffman when I first took this job. It's been one of our priorities as we've moved through, which is why we put our own dispatch center in place, why we put cameras in place, why we've increased the training, why we've split hours of shifts. So that whole concept of response time has been a super high priority of this division from its inception.
And then also traffic control. That's another way they use this map. They use this mapping software many ways, traffic control, analysis, what time sequential, things like that. So that's what I was wondering if, and I pushed that because I knew they do that in different school districts, but yet our school district doesn't use it as much as it should. The facility uses it. That's the only department that uses it right now, but I'm trying to get our staff and Mr. Hoffman more astute using that software. How we could. Okay. Thank you. Thank you.
Dr. Martinez Soler.
Nice work.
Thank you.
Sorry for being loud.
Can we have the, I don't believe we need the slides anymore. And Dr. Martinez Soler, please.
So I'd like to thank you for your presentation and the information that was presented. I know a number of my colleagues have asked very thorough questions. I had questions as well, but to be respectful of time as well, I'll kind of narrow down some of those questions. And I thank you for also providing the opportunity prior to this meeting to ask those questions more thoroughly as I've met one-on-one with Mr. Hoffman. So thank you for that as well. Any questions I have, being able to communicate with me prior to the meeting.
Excuse me. Excuse me. I apologize for interrupting you, but I need another motion to extend the meeting.
So moved.
I'm gonna move that we go to 11:30, but I think we're probably gonna have to do this again.
No, we're gonna go to 11:30. We will be done soon. I am putting on my cape. Let's go. Dr. Martinez Soler, thank you. I apologize. I need a first from Mr. Fortuna, a second from Dr. Martinez Soler. Thank you. Roll call, Mr. Yang.
Yes.
Ms. Charis Espinoza.
Aye.
Mr. Perez.
Aye.
Dr. Martinez Soler.
Aye.
Mr. Fortuna.
Of course, because I love spending my time with all of you.
And myself, it's unanimous. Moving on.
So going back to the presentation, I really liked how the sites came in from the elementary up to the secondary, giving the perspective of the work that's currently being done. I know that right now we're in some unusual circumstances with COVID, and I like the graphs that you provided. I also had questions regarding this campus supervisors positions and the diversity, but it seems like that's going to be continuous work that you'll be doing and ways to improve on. As I know, like with anything in life, there's things that we try to be the best model for, and we strive for that, but it takes time and nothing's perfect. So over time, we can begin to move the process forward. And those are one of the things that I see moving forward. Much to some of the comments mentioned by my colleagues regarding the CSU system or Sac City, I know they have programs that are geared towards criminal justice. So maybe we could partner with something close by, possibly to get some pathways of students who might be interested in becoming an SRO officer or even a campus supervisor down the road. Just a possibility, that outreach work. You've done tremendous job of training staff from what you have mentioned in the past. You've also, I like the feedback that you have given regarding the implicit bias training and that continuous outreach, and also the Arbinger training work that you're doing with the outward mindset. I appreciate that as well. And then in regards to the mental health, I'm glad that you were able to follow up and provide an answer earlier when we're not having the 5150 holds, but again, making sure that a mental health person is following up with those families or the site administration, because I feel like that's crucial. I just have one question regarding the incident reporting. I'm glad to hear that it's working. Are there any changes or any modifications that you'd see that might be helpful in the incident reporting now that we're given the COVID times or these certain circumstances going on? Do you see any need to change that?
I think we need to be cautious and everything is changing so quickly and how we respond is changing so quickly. And what information we need to know and retain is kind of evolved, especially when it turns to the incident reporting system. You know, I think one, we retain it all. At least we do in this division, and we're going to begin to track it. So next year, you all will have some idea of the extent and types of calls. So I think I'm reluctant right now to really try and shift that system too much, because I'm not really sure where we're going to end up going with it as we return. And I think when we return, I think we're going to see students with just as much stress about returning than we are with people gone. I mean, this is going to cut both ways. And so it's a good way of us getting information about what's happening on some issues that we may not see. And I think one of the principals spoke to it earlier. You know, we're not seeing them face to face every day, and so this right now we're viewing it as just another information source that we could use to make sure that we're giving our students. And to be frank with you, we've had some issues with staff that have come through on that we've had to work through. So I think it's good. I think it's working. I think it's something we can improve. But I think we just need to make sure we understand what it is before we tweak it too much.
Thank you. And again, I commend the staff for the work that they're continuing doing, you know, given the circumstances, being able to be flexible and also handing out the Chromebooks or the hotspots and visiting the home as you need. My understanding was when we talk about attendance, given the fact that we're in distance learning now, I believe we had some numbers previously at another board meeting where it was about 95% success rate at some of our sites. So I commend the work that's being done and look forward to continuous updates regarding the safety and security of our district. So thank you.
Thank you.
Thank you, Mr. Forcino.
Okay. I will try to be somewhat quick. First of all, Joe.
Yes, sir.
With respect to site safety, what role did the department play in the identification of security camera placement and the current implementation of that program?
So we were involved really from day one. As we worked through it with the consultants and recommendations, we received several models of a minimum placement, a mid-ground placement, and a maximum placement. And so we spent the last, I want to say 6 months prior to implementation of the test sites, looking at different models of how we were going to secure campuses. So we have because we have to budget, because we have to go out for bid, we had to come up with some standard configuration. Once that's in, if an administrator has an issue or there's areas that need additional coverage, they've put it on the table. We've had discussions with them and we have modified it on a case-by-case basis. So again, the first 5 test sites went on. We're now implementing the first contract for the first set of sites. Again, it's a brand new thing for us as far as the whole concept, how it works, how it functions. But one of the things we did do is make sure that we have the capacity to modify any of these configurations as we move forward based on the needs of the sites.
Okay, and how are you addressing the new construction specifically that's going on at Elk Grove High School and at Kerr Middle School, since those projects are extensive?
The adaptation of new cameras is going to be integrated into the modifications. So it won't be something that's done after, it'll be something that's done during the construction. And to be very specific on an answer, I think we might have to get facilities involved in that one.
Okay, so if a new building is going in on one of the sites that is
pre-wired,
pretty remote on the campus, it'll have a camera.
It'll be pre-wired as it's being built. Once it's finished, then the cameras will be installed as part of that finalizing process.
All right, thank you.
Mhm.
I'm not going to ask a question on mental health supports. I have enough information right now, and I'll come to you. But how do you provide support to the programs like PBIS? You talked about how you provide mental health support, but you didn't address really how you support the programs that each of those services provide.
We view our function. Go ahead, Rich.
If I could jump in here, one of the things that I did not put on the list of training topics was with campus supervisors. And I should also mention, and I forgot to mention this earlier, we do have our security specialists come in as well, not at every single training, because we still need to do the job out in the field. So they're involved in that. One of the trainings we did provide was Lisa Vartanian came in and did PBIS training with the security specialists as well as the campus supervisors. And just a really quick story related to that. It was the first day of school last school year, and I walked into one of our middle schools where the lead campus supervisor was doing a PBIS training with the kids in the cafeteria on how they were to behave in the cafeteria. And so that's an example of how our staff is integrating with PBIS at the sites, and they do an excellent job. And so when I saw that, I asked him to present at the next campus supervisor meeting, and he was able to do that. And so I don't know if that answers your question entirely, but that's an example of how we try to integrate the training and the function on campus.
We had the same kind of, it's a situation with special ed. The folks in special ed have been great in coming in and working with our campus supervisor staff, our school security staff, and our school resource officers in understanding the concepts of special ed and what are indicators and what things they may watch out for and help de-escalate, and just having a better understanding of some of the issues that our students are dealing with. So, you know, again, we didn't list every bit of the training we did, but we try and make sure that our folks are understanding the programs that are going on campuses and how they can add to that and not be a hindrance to it.
Okay. All right. Quite a bit of time was spent on demographics. And without stepping on any toes, that's not my intention. The campus supervisors and lead are not technically, quote, your department. You provide training, but the principals provide the day-to-day supervision and the evaluation of those people, as well as the hiring. So could you for us, at a point, doesn't have to be tomorrow, break out the demographics for your actual department, those people that are actually within police services?
So just a couple of things. One, the camp supervisors are in my budget now. So they do belong to safety and security.
When did that happen?
About 2 months ago, I think.
Without the approval of the Board of Education?
I'm not sure about that.
That's a big issue. We'll go back to that one. So does that include, so has supervisory responsibility transferred to you from the school site principals?
What is transferred to us, Mr. Fortino?
Excuse me, evaluation responsibility been transferred to your department?
Actual evaluations, they run through us now. Once the site administrator who evaluates them on a daily basis, and then we are going to be working with them to go through that process. Yes, we also do the reporting of absences through our department now for campus supervisors in the payroll system, and so yeah, those things have transferred over.
The reason
a lot of transfer without discussion of the Board of Education.
So the transfer was a result of us having to take campus supervisors and pull them from sites and use them in other locations, like at the elementary schools. If I remember correctly,
This isn't a permanent change, Carmen. This is an adjustment we're doing right now with regards to the campus supervisors are helping with Chromebooks. The campus supervisors are doing a wide variety of pieces. So this hasn't been
the campus supervisors helped with the teachers and the administrators at the school sites, because since we have no children at the schools, they didn't have anything to do. Let's be clear.
Again, they've been doing
one of the reasons why they were doing that.
Correct. They've been helping with a wide variety of issues outside of supervising kids, because there's fewer kids to supervise. Agreed.
You don't have the staff to provide day-to-day supervision of the campus supervisors. If you're going to be responsible for them with vis-a-vis their evaluations, which then includes hiring, firing, and improvement plans, how are you going to accomplish that with the staff that you have in place?
So the supervision system is the same as the custodians. They're supervised by the site administrative staff, but we are in constant contact with that staff all of the time. We do all of the hiring is coordinated through us. If there's a recommendation for improvement, it's coordinated through us.
I think we have to have a discussion at a different point in time, not do it tonight.
Looks like you're working out of class.
I got a number of issues. When arrests take place, they take place either by Elk Grove Police, County Sheriff, or Rancho Cordova, correct?
Correct.
Okay, thank you. Are the services in our new model being provided equally amongst all of the sites?
I believe so, yes.
Okay, I'm not going to ask any more questions right now. I guess I'm really disturbed over the issue of the campus supervisors, because I've been discussing this particular issue, certainly with you, Joe, and certainly a bit with Chris. So I'm going to definitely want to follow up on that issue so that I have a clear understanding of the relationship, and more importantly, so that the principals and the campus supervisors have a clear understanding of the relationship, because I don't believe that clear understanding is there. So I would like to follow up on that one, and I'll schedule a meeting.
Yes, sir.
I'd like all of us to hear the conversation also. I'm interested, yes. I think it should be on the board item.
I don't care how I do it. I do it anyway. I'll do it any way the board wants to do it.
Mr. Fortino will have his meeting and we can send out a BC with anything that needs to be clarified.
And we can invite
And if you would like to
Perez,
have a meeting
one of the
yourself,
kids.
Mr. Perez, please feel free to schedule it.
I'd like to make the motion that we all listen to this conversation. Anybody second that?
I'll second it.
Okay. I'll call for the vote.
Is there any discussion?
No,
I don't feel there is a need for me to attend that meeting at this point. If you are of a certain interest to that meeting, then I believe you should attend. If we have more people on the
that
board
works.
than is allowed by a quorum, then I suggest that we take it up at that point. Please contact Mr. Hoffman directly if you'd like to be included in that meeting.
we are requesting a board item to be
I
on
heard
the
you.
board.
I heard you. I just spoke against your motion. So
Okay.
now we have a vote.
I call the vote.
Sounds good.
Carmine, can you explain what is it that you want Joe and Rick to present to us so that I understand a little bit better?
I don't want them to present anything.
What do you
I
want?
would like to have an understanding of why changes were made without any consultation and or notification to the Board of Education. Number one. Number two, I would like to talk about the way in which information has been communicated such that I have an understanding that all site administrators and campus supervisors have the same understanding of the relationship between their principal and security services.
And we can hold that meeting, glad to do it, and then we can invite up to 3 members to be part of that. We'll do a follow-up BC for the entire board. And then at that point, if somebody wants to do put it on as a separate item, I don't think it requires an entire board item. We can address those issues and get the information so everyone's on the same page.
Also, it's a labor issue. We should have, they're working out of class. You look at their job description. They are not supposed to be delivering anything to campuses. That's working out of class. It's a
Mr. Perez,
We're all being more flexible in this current time.
we're in a pandemic.
Yes. Working
Okay,
out of
I do
class.
need a vote. I have stated my point. Mr. Hoffman has offered his point. That is our discussion following the ask for a motion that was seconded, so I have to have a vote. Mr. Yang, you will be voting to either have a request to have this brought back, which what is on the agenda is up to my position as a board member. I can choose what that is. So you can vote for Mr. Perez to agree with Mr. Perez to request it being put on the agenda.
No, clarification, point of clarification. It was not, it was Mr. Fosina brought it up and I seconded it.
No, you made a motion. Mr. Fortuna seconded it. Would you like to withdraw your motion, Mr. Perez?
Okay, point of clarification. Okay, good with me.
Do you want to withdraw your motion?
No, ma'am.
What?
No.
No. And then Mr. Yang, so if you vote in favor, then he is requesting me to put it on an agenda. If you vote against it, we will go with, as we discussed, it will be a meeting Mr. Hoffman will have, and we will also receive a BC with the clarification to all members of the board. So a yay or nay, Mr. Yang?
Can I make a comment?
Of course. I'm sorry. I
Okay.
didn't realize you were in discussion.
Well, I think what Trustee Carmine alluded to, I thought it makes a lot of sense. But this is actually a very important issues or clarifications. But I think it could be done either way. I like what Baf say as well. I will vote, well, I want to be involved one way or another. So if we put on the agenda, that means Joe and Rick have to come back and present it to us during open section meeting like now,
It's
like next time, right?
no, it will be requested to be put on the agenda. I set the agenda with the superintendent.
I would request a history of how this evolved.
I would, okay. Would you like us to come back to you, sir?
Yeah, let's do that.
Great. Ms. Charis Espinoza?
No, this matter is not a surprise to me. I feel like I've been informed of the way that people are doing different work since we all adapted to distance learning. So I don't feel the need to have another item on the agenda for that. Thank you.
Mr. Perez?
Yes, and I would like the labor representative of those individuals present also to give their input.
Dr. Martina Soler?
No, I would like a BCC. And then is it possible down the road if we do need to address this, like from the BCC, if we have more
We can
questions,
certainly
we
do it
can,
if the-
right?
Yes.
BC
Okay.
doesn't cover it, we can certainly do an agenda item down the road.
Definitely. Mr. Fortuna?
No.
Thank you. Myself is a no. Mr. Yang?
I agree with Crystal. Yeah, BCC us, vote no for now.
Thank you.
In that case, I would like those individuals in that union representative to give some input on the BCC, if they're working out of class, yes or no?
Yeah. Oh. You can speak to Mr. Hoffman about that, sir.
No, union representation should be present and give an opinion.
You can talk to me about it, we'll walk through it.
They're working out of class.
Moving on. Thank you very much for your presentation tonight. I only have one thing to say, and I actually want to express my appreciation to your department for their willingness to step up and help where needed in this crisis and this worldwide pandemic we're trying to get through. So thank you very much, Mr. Rosa Lozano. We're moving on to item number 8, public hearing action items. We have a consideration and public notice of Elk Grove Unified School District's initial proposal to California School Employees Association regarding collective bargaining for the 2020-2021 school year. Mr. Riley, to present the item.
Good evening, President Albiani, members of the board, Superintendent Hoffman, Ms. Avalos. Pursuant to Government Code Section 3547, the following are stipulated for negotiations between a bargaining unit and the district. The district's initial proposal is officially presented at a public meeting of the governing board for public notice, and 2, a public hearing is conducted to receive public input regarding the district's initial proposal. EGUSD's initial proposal is attached.
Thank you. I'd like to open the public hearing and call on Ms. Pinkerton to read any public comments related to this item.
Madam Board President Albiani, there are no public comments related to this item.
Thank you. I'd like to close the public hearing and call for a motion to accept EGUSD's initial proposal to the CSEA regarding collective bargaining for the 2020-2021 school year.
So moved.
Second.
Moved by Ms. Charis Espinoza, seconded by Dr. Martina Soler. Mr. Yang?
Aye.
Ms. Charis Espinoza?
Aye.
Mr. Perez?
Aye.
Dr. Martina Soler?
Aye.
Mr. Forcina?
Aye.
And myself, thank you. Action item, a resolution to eliminate classified positions. Ms. Pinkerton, is there any public comment related to this item?
Madam Board President Albiani, there are no public comments related to this item.
Thank you. Mr. Riley?
Thank you, President Albiani. The board is asked to adopt the attached resolution to eliminate classified positions due to lack of work, lack of funds pursuant to Education Code Sections 45114, 45298, 45308, and 45117. I'll just add a comment that no individuals were adversely impacted by these. These are positions that are vacant due to a resignation and a retirement, and it's part of an overall restructuring effort.
Thank you. I would like to call for a motion to adopt resolution number 34, authorizing the governing board to eliminate classified positions pursuant to Education Code. Mr. Forcina?
Aye.
Ms. Charis Espinoza?
Aye.
Dr. Martina Soler?
Aye.
Mr. Perez?
Aye.
Mr. Yang?
Aye.
And myself, it's unanimous. Thank you.
Did I miss a first and a second?
We got a first from,
Okay, I must, maybe it's getting late.
there's truly no telling at this point, sir.
Okay, all right.
Do I have
There
a first?
I
had a
don't
first from
believe
Mr.
there were
Fortino.
any. Yeah, there's no second.
I'll make a motion.
Thank you. Dr. Martina Soler, do I have a second?
Second.
Second that.
Thanks.
The
Second
vote-
by
the
Mr.
vote's good.
Fortuna. Thank you. Your votes hold. All right, new non-represented employee employment agreement. Ms. Pinkerton, is there any public comment related to this item?
Madam Board President Albieri, there are no public comments related to this item.
Thank you. Mr. Riley.
Thank you, President Albiani. California Government Code Section 54953C3 requires that a verbal summary of the proposed compensation and fringe benefits be given to the public prior to final board action on certain employment agreements. The proposed agreement for the following Chief Human Resources Officer contains the following material terms. One, term. The term of the proposed employment agreement for Chief Human Resources Officer begins on February 1, 2021 and shall continue through June 30, 2023. Two, compensation. The following constitutes the employee's base salary effective February 1, 2021. The Chief Human Resources Officer is on step 9 of the Chief Human Resources Officer salary schedule. Effective February 1, 2021, his base salary at step 9 shall be $154,476. Three, benefits. The Chief Human Resources Officer will receive the same health and welfare benefits and retiree benefits as other district certificated management employees, as those benefits may change from time to time. Four, travel. The Chief Human Resources Officer shall receive $100 per month for travel within the district's boundaries, irrespective of the number of miles traveled on district business and general business expenses that the CHRO incurs in the official performance of the CHRO's duties and responsibilities. 5, work year. The Chief Human Resources Officer's work year shall be 246 days. 6, job description. The Chief Human Resources Officer's duties shall be consistent with the Chief Human Resources Officer's job description, which is attached to and pursuant to Section 6, incorporated by reference into the Chief Human Resources Officer Employment Agreement. Therefore, board approval of the Chief Human Resources Officer Employment Agreement includes approval of the Chief Human Resources Officer job description attached to such employment agreement. This concludes the summary of the employment agreement for the Chief Human Resources Officer. A complete copy of the agreements are available from the district office upon request.
Thank you. I'd like to call for a motion to approve the Chief Human Resource Officer employment agreement.
So move.
I have a first from Dr. Martina Soler, a second from Mr. Yang. Is that correct?
Yes.
Thank you. Roll call vote is required. Mr. Yang?
Discussion, please.
Oh, you have a comment, Mr. Fortuna?
Yes, I do. Per our board policies, we as board members cannot abstain unless we have a conflict of interest, which means that we either have to vote yes or no. We have existing positions within the office, which certainly in a sense puts me in a position of having to vote yes in fairness to this employee. But I don't agree with the salary structure for the position and the level that it's placed when I look at this position in comparison with site level positions. So I will vote yes on the position, but have many objections. Thank you.
Noted. Thank you. Mr. Yang?
Aye.
Ms. Charis Espinoza?
Aye.
Mr. Perez?
Based on the information I just received, no. And Chair, I like to make the motion that we chair this issue until we get further information to make a good decision with all the facts.
Mr. Perez, we have been presented all the facts and had this available to us.
Hiring.
What?
It's hiring, sir.
Yeah, but hey, we didn't know the salary range.
It's been public and available to us for a long period of time, sir.
And what's the other issue regarding conflict of interest?
There is no conflict of
There
interest.
is no
Mr.
conflict.
Fortuna mentioned that he does have to vote. And he did have some reservations and has chosen to vote yes and explained why.
Okay.
Did you still want to make a
No.
motion or do you want to vote? Okay, what was your vote, sir?
No.
Thank you. Dr. Martinez Solir.
Aye.
Thank you. Mr. Fortuna.
Aye.
And I myself. Number 3, an appointment of a representative from Elk Grove Unified School District to the California School Boards Association Delegate Assembly. Ms. Pinkerton, is there any public comment related to this item?
Madam Board President Albiani, there are no public comments related to this item.
Thank you. There's a vacancy on the California School Board Association. That's what CSBA stands for those that don't know. Delegate Assembly, and the board is asked to appoint a member for a 2-year term beginning April 1st, 2021 through March 31st, 2023. I would like to call for nominations.
I would like to nominate Ms. Chaitis Espinoza.
Thank you. Are there any other nominations?
Mr. Yang, I nominate Mr. Yang to get involved with this.
Thank you. Discussion, Mr. Fortuna.
I have no discussion. I think I'd like to hear from both Sean and Nancy.
Thank you. Mr. Yang.
Why don't Nancy go first? Ladies first.
Okay,
Sure.
Ms. Charis Espinoza.
Sure. I have a long history with the California School Boards Association. As some of you know, I actually used to work for them. And I initially made it a point to not pursue the delegate assembly position because I wanted to put some distance between myself and the organization. But with some years of distance now, I think I'm ready to come back in a civilian role for the organization that I used to work for. And of course, through my day job, I already have a network of school board members, and I just love to represent the organization, to help represent the district among the organization of our colleagues. Thanks.
Thank you.
I have a question regarding that. In her position, do you have an issue, or would it be an issue with your present job and doing this?
Not at all.
Or would it be overlapping what you're doing now?
Not at all.
And I'm concerned regarding your health issues. Can you fulfill those issues because of your health concerns?
No issue, no concern.
Ms. Martinez Soler, would you like to make any comments in our discussion?
Other than that, I know of her prior experience in working with the organization and think that she would bring a breadth of knowledge to represent the district. That's why I had called for the nomination for her, knowing that given her history and experience in the collaboration between different districts.
Thank you. Mr. Yang, did you want to speak?
Well, I'm flattered that Trustee Perez mentioned my name. However, based on what Nancy has shared with us, I think at this point, she's a better candidate and I would support her.
Okay, thank you very much. So, Mr. Yang, I take it you have declined your nomination?
Yes.
Okay,
Thank you, Tony. Appreciate that.
Ms. Charis Espinoza, have you accepted your nomination? Ms. Charis Espinoza, you accept the nomination?
I do.
Thank you. And Mr. Perez, did you have another comment, sir?
No, that was those 3 issues that I was concerned about.
Okay. Right, then I would like to call for a motion to appoint Nancy Charis to the Board of California School Board Association's Delegate Assembly as a representative of Elk Grove Unified School District. Can I get a motion?
So moved.
So moved by Dr. Lear, and a second?
I'll second. I was waiting for the person who made the initial recommendation.
Sounds perfect. A second, and that'll call a roll call vote. Mr. Fortuna.
Aye.
Thank you, Dr. I've done it again. Ms. Charis Espinoza, you should go get a doctorate.
Apparently. Aye.
Thank you. Dr. Martinez Soler.
Aye.
Mr. Perez,
Aye.
Mr. Yang,
Yes.
and myself. It is unanimous. Mr. Yang, I believe this will be a great job for you to go to in the future. And I think going to the County Office of Education is a good place to start. I think you'll learn a lot there that you can take in this next position.
Okay.
Our next is board member and superintendent reports. These are things that are related to committee work, organizational and committee meetings related to the district operation, our district's operation. Starting with, does anyone have one? You could raise your hand. Thank you. Other items from the floor? Mr. Fortuna.
Thank you. Okay. As a school district and as a Board of Education, we have always based our decisions on data. But over these past few months, I have felt strongly that we have abandoned data-driven decisions with respect to student learning. Even now, as this Department of Education looks towards the implementation of the California Assessment and Student Performance and Progress Assessment, there's a large organization that is trying to have that assessment suspended for the second year in a row. And I believe we need to take an active role in supporting the Department of Education in its desire to have that assessment be executed. Many have said that distance learning is going well, while others have said that distance learning is failing their student. There's probably some truth on both sides, but without data, both of them are just beliefs. What I believe in is that it's time for the administration of standardized testing to determine the level of learning that has occurred for our students. I believe it's time to convene a committee of all stakeholders in order to develop a plan for in-person instruction. And I believe it is time for all students to be back in the classroom with their teachers and those activities that better their lives. And I believe it's time that we file for a state waiver. And perhaps most importantly, I believe it's time for the Board of Education to execute its leadership role. And in so doing, I move tonight for the immediate formation of a board committee inclusive of all stakeholders to develop an in-person education plan that is equitable for all students and inclusive of all activities, and that this motion be placed on the next board agenda for discussion and a vote.
All right, you've asked to have that put on the agenda.
Yes, I do.
Is there a second?
I have a question.
Yes,
What's the time frame
immediate.
to meet the new governor's plan, to submit a proposal?
immediate for the establishment of an inclusive subcommittee of the board for the purpose of developing an in-person educational plan that is equitable for all students. And that be on the next agenda so that we can move forward quickly.
Madam Chair, I have a clarifying question. as
How
well.
would that be different from the governor's Newsom's plan and the time frame?
Mr. Perez,
The difference is we have a responsibility as a school district to develop a plan.
I agree.
What I am recommending is that we move quickly to form a committee of all stakeholders for the purposes of determining what that plan looks like and how it would be implemented.
For what purpose?
So we can
to
get
open
back to school.
No, I want clarification because
Well, I mean, that's it. So we can get back to school.
Yes, but I wasn't sure if it's your plan or the governor's plan objective and his timetable. That's why I asked. There's a timetable which we need to get together and submit a plan for that within next month, looks like.
Madam Chair, I have a question.
hold on, please. Yes, Ms. Chair Espinoza.
Carmen, my understanding is that we have a reopening plan and we have a safety plan. The only thing on which we differ is the trigger, when to put it into motion. So could you kind of clarify what your motion is in light of that?
Sure. Number one, I've never supported the concurrent model that was proposed, and I voted no on that. What I am proposing is a plan for full in-person education, inclusive of all school activities. And that the plan be developed in conjunction with representation from all stakeholders. That has never occurred.
Does full in-person mean we would not offer distance learning as an option?
No, that would be available for those families who would opt out of returning their children on a full-time basis.
What about testing for staff and our students?
That's what the committee would have to address in terms of the development of the plan. I mean, that's a component. There's a lot of components.
I have a clarifying question. So we're talking about, just so I kind of gather what you're saying, talking about abandoning the plan that's tied to the county tier system right now with the amount of cases that we're currently under, to abandon that completely and go to full distance learning with you said full in person with the option of distance learning for the committee to address that.
Correct.
Okay.
And let me ask you that if the number of cases goes up and they close us down, the whole county, what are you gonna do?
That's not my decision, is it?
Well,
No, I mean, it's not mine as an individual, and you want me to speculate. We could have been open all these many, many months.
We could have been a lot of things.
Yeah, well, we didn't,
Okay.
and there hasn't, and prior to tonight, plans that have been developed have not been inclusive of parents, students, teachers, administrators, on and on and on. I know there's objections to that last statement, but there hasn't been people included who have differing opinions from the direction in which the district has gone. My motion is very simple. Establishment of a board committee for the development of a plan for the in-person return of our students. And concurrently with that, and the committee would address it, would be the maintenance of a quality distance learning program for those parents who are not comfortable returning their children.
All right, do we have a second?
Can I make a comment first? Or question?
Yeah.
So trustee Cressida, so just to clarify, so what you're saying is that we're gonna make a decisive decision to just go ahead and open on-campus school for students with the options, with the options of having distance learning.
Right.
And then we're gonna disregard the Sacramento County healthcare, regardless of
we're
their.
disregarding anything.
Well, I'm just trying to understand. So because my understanding is they are advising us not to have on-campus schooling, right? Am I understanding correctly?
Yes, that is the advice we received today.
So are you saying that we're gonna disregard that advice and we're gonna go full force of creating a committee where we're going to have on-campus schooling with the options of distance learning? I'm just trying to understand your request or your motion.
Right.
Okay.
Irrespective of the recommendations or the opinions or information provided by county health, we could have and still can ask for a waiver and go back to school. We can still do that.
The waiver's currently not on the table.
I believed that it was still on the table.
She was referring to the governor's plan, but the actual waiver that was in place previously, the county's not currently accepting waivers that were part of the old process. What they will be looking at is once the governor's finalizes this new idea that he has, if he gets something finalized with the legislature, that those plans can be brought forward. But those plans are tied to the way the governor has it, that schools can't reopen unless they get underneath the 28 number. And then when they get in, that they open in the 28 number, it needs to be in a process that has the full testing of kids and staff in place. So those are the details that we need to figure out where we are, because right now it's the governor's proposal, but he doesn't have, the legislature hasn't shared their view yet, whether they're going to modify that, because there's another, there's AB 10, which is in the legislature right now, which is their proposal for how to do it. So right now you have two people, and we don't know which one's going to be the lay of land. The other thing that we have is supposed to happen today. Dr. Kassiri said tomorrow or sometime later this week, the California Department of Health is setting a new set of guidelines, which are going to supersede the previous set of guidelines with regards to the function of school. So I think it's a bit premature until we know what the parameters are moving forward. If the conversation is about what school will look like when we come back full, I mean, that's a conversation. But if we're going to, in spite of everything else, we're just going to open schools fully. I mean,
at the speed at which we accomplish things, it's not premature.
Carmine.
I'm real comfortable in saying that. And it's my motion, and I certainly appreciate the fact that people are asking for clarification. If I get a second, we'll vote on it. If I don't get a second, it dies.
Madam Chair, call the question.
Also,
So call, there's been a call
I'd
for
like to make
question.
point of information.
Yes.
That the dollars are being discussed right now. Where is it going to come from? Either from the Department of Public Health or the Department of Education. There's legislators do not want to use education dollars on this issue. They rather use health dollars.
There is a conversation with regards to whether, and districts are saying that the governor's plan shouldn't be funded out of Prop 98. It should
Right.
be funded out of other funds. So that answer isn't out there yet either.
Let's come back to Mr. Fortina's motion. I have one comment. I believe this is premature at this point. I understand your frustration, and I understand the clarifying points you've made. And that's my contribution. So now we will vote. Is there a second?
There's no second on the table.
I just asked for a second. If there is a second. There's no second. We will move on. Other items from the floor.
So I did want to ask one question, Mr. Fortina. You started off with a conversation around the assessment system, and I'm happy to have that conversation with you to make sure we're on the same page, and if there's anything that we can do to make sure that I think some testing this year would be of value. So if there's something that you're privy to there, I'd be happy to have that conversation with you.
Can I ask a question?
Another item from the floor, Mr. Yang?
Well, regarding this issue on campus schooling, is that on the floor?
No.
This is the point of the meeting where we bring up other items that were not on the agenda. We are not supposed to have long conversations about them. There are other items from the agenda, possible suggestions and things. Did you have a question that needed to be answered by the whole board or someone on the board, or?
Yeah, well,
I want a
right.
question from you.
My question.
Excuse me, it's Mr. Yang's turn.
My question is, as a new board member, I just would like to know what the plan is or was that we have in place to bring students on campus so that I understand what our plan is.
Yes, I'm
Because I don't have that information.
to meet with Mr. Hoffman, and we'll also make sure you have a copy of the MOU that we are have signed with our labor union. And that is the current basis of it. And then when we have the newest regulations, those will help as well. Does that satisfy?
Yang, I'll set up a time where we can.
Okay, yeah, let's do that.
Okay, Mr. Perez, did you have a last comment?
No, I have a question. Are we as a board going to pursue Governor Wilson's funding to reestablish school?
Wilson's been gone for a while, so we are going to work Mr. Newsom's.
Yes, are we going to make a decision tonight? Because
No.
by the time that you people want to make a decision, that money's going to be down at other school districts.
The timeline's going to be okay, Mr. Perez. We'll share the information with you on the 20th.
Mr. Perez, we'll have full information on the 20th to share, so know what we're talking about. And just so you realize, when you say you people, it's very offensive, sir.
I'm sorry.
Us, we're all on the same
Like
team.
you people, I think we're an us that is working for an organization together.
I'm worried that we're foot dragging again, that our staff isn't working on this plan and try to get on board and see, and even negotiate or talk to your legislators about this issue, what your concerns are. You know,
Madam Chair, I have one item.
Okay. Yes, Mr. Perez, I've heard you, sir.
Thank you.
Yes.
Sorry.
Ms. Charis Espinoza.
I just would like, for the benefit of all of our members, to remind folks that our board bylaws do state that we will do our homework and prepare in advance of meetings. So if we find that we have a question on every single page of a presentation, that is really the kind of work that we need to address in advance of a meeting, not live during the meeting. And I understand there's no bright line, about how many questions you have or things like that. But if you have a question on just about every page, that's something you take up in a meeting before the board meeting. And if you have a full page of questions on an issue, that's a homework type thing. So I just want to remind folks that we all agree to that in the board bylaw. So let's be respectful of the folks who are dependent on the business that we do. Thanks.
And
I
I just had a comment.
Point of information.
It's Ms. Martinez, Dr. Martinez Lear's turn. She's spoken very little tonight.
I was just wondering if maybe we could provide or make sure with the new board members that will be coming on the board handbook too, and maybe we can all revisit that handbook again regarding our processes for the school board.
Yes, I believe as we have when we have our new board member, and possibly before if need be, but I plan to do a little bit of, I don't know, as good as I can, virtual team building and including that education and reestablishing some norms and expectations. We're definitely in a period of transition, and I think that's unsettling for many and has gotten us out of a little bit of a rhythm we were in. So trying to come back to a base together is on the agenda and in the plans. Mr. Fortino.
My last question, because it needed to be asked with the entire board. Will we be afforded the opportunity to submit questions that we want to ask the prospective board candidates?
So my plan is we have a little tricky. So I'm gonna add an item to the 20th to kind of talk through process for the 26th, because it's going to be a Zoom version. So it's going to be different than we've done in the past. So I have some ideas around that. I spoke to Karen Resendiz today to make sure. So there's some ideas about public comment and providing some opportunities, and then fairness for the candidates. So we don't, because it's the questions are going to be live. If we did one candidate and the first person answered every question, every other candidate hears all the other questions ahead of time. So thinking about having them all on. We ask the first question, and and one person, they all go through and answer the first question, and then we're working through some processes because we have to do it differently than done in the past. And I wanted to give the board time on the 20th to talk that through a little bit.
Right, but that's process. I was asking specifically about the questions.
Yeah, the problem is the questions. What we'll do is what we've done in the past is we have the board submit questions and then we put a batch together. But the trick is we want to make sure that they're not known ahead of the interview. So it's a little bit of it, but we have a process to be able to take care of that as well.
Okay.
I thought we were going to ask the same questions that we did of Nancy Titus and the other individuals. Are we changing up the questions?
We'll have that conversation. You'll have an opportunity to provide feedback.
They were fine with me. They're simple questions.
They weren't so simple, but
yes.
Were they simple, Nancy?
Not when you're in the hot seat.
Hey, it took me 3 or 4 hours to get 4 votes. That was silly.
Okay, it's 12:04. I now am adjourning the meeting. Good night, everyone. Take care.
Take a vote. Roll call vote.
Hey, Sean,